Good evening. I'd like to call this April 13th Operation Fifth Group meeting to order. But as far as I know, we have no written statements or public statements. So moving on to the approval of minutes. I move to approve the minutes from the group meeting dated March 9th, 2026. Board member Lee, or can I get a second?
Second.
Second board member Vanderbilt and board member Lee, your advisory vote.
Aye.
All those in favor?
Aye.
Motion carries 5-0. All right, so we have a packed meeting tonight. So I will pass it right off to Bob to get us started.
Well, actually, Bob's not first. I apologize for that, board member Castro. We're going to begin tonight with our first agenda item is a discussion of further discussion about our healthcare benefits and overview. So Jennifer Trendle, Human Resources, and Rachel Carabell are here, benefits specialists, to begin the presentation.
Okay, right over to you, Rachel.
All right. Good evening, members of the board. Thank you for having me. We wanted to provide a few updates. If you want to skip ahead a few slides. Oh, I can drive. Thank you. We wanted to provide an update on some information that we shared after the last meeting to talk about our employee benefits programs and the renewals that we received from our health carrier. This is the current state, so this just shows where the current enrollment is amongst their plans, how many are in dean and courts, how many people are enrolled single family, and then by employee group. As you'll recall, we are expecting on average costs for health insurance are going to increase by 17.3% based on the renewals we received from our health plans. That's an estimated $14.4 million increase to the district spending. Last time we shared a couple of options that the board consider if it would like to reduce that increase. One of them involved changing the employee share of premiums. Currently, there is a tiered approach in how we determine what percentage employees pay as a percentage of the premium. This first option, which we shared last time, would increase that share by 2 percentage points for all employee groups. If the board adopted that option, that would reduce district spending by 2.1 million. That's 2.1 million off the 14.1 million increase that we're expecting. Couple things to keep in mind. This maintains that tiered approach where our lowest income employees would continue to pay the least. These premium payments are paid pre-tax. They're deducted from employees' paychecks, so they are taken pre-tax. So that would help partially offset the increase. With this change, the average employee share would increase from an average of 6.2% to 8.2%. This would bring us closer to what is more typical in Dane County. Most other school districts in the county also, or they charge between 10 and 12%, and other large districts do as well for their full-time employees. Next slide. Oops, sorry, never mind. Thank you, Jesse. At the request of the board, we did put together another option that we're bringing back for you. Under this option, the request was that we look at maintaining the current employee share for our lowest income employees, and all other employment groups would increase by 3% instead. Under this approach, the reduction in the increase would be 2.6 million. So again, that would be 2.6 million less than the 14.4 million we're expecting. Again, it really protects those lowest income employees. Under this option, the average employee share would increase from 6.2% to 8.6%. Okay, so there are those two different options for changing the employee share. This table shows what those current shares are by the different employment groups. So our educational service security assistance, they're currently at 2.5% of the of the premium. Under that first option, that would increase 5%, but it would, under this latest option, it would stay at the 2.5. Again, our teacher group, teacher, custodians, trades, et cetera, would go up to 8% under the first option and 9% under the second option. You can see the professionals and administrators there. And 6.1% is the current average. Under option 1, it would go up to 8.2%, and under the second option, go up to 8.6%. The other option we talked about last time was the idea of offering a choice between our current plan designs and a high deductible health plan, and pairing that high deductible health plan with a health saving. Now, this would be a choice that would be available. Those employees that wanted to stay with our current standard plan certainly would still have that option, but for those employees that are looking for a lower premium plan or are looking to build up an account based on that health savings account, those employees could move to that choice, that option. Well, we would start that during open enrollment this year, which happens in the fall, for an effective date of January 1st. If the board adopts this option, we would make this option available to our new hire starting this fall. It would take effect September 1st. We know a lot of school districts offer a choice between a high deductible plan and other standard plan options, including Middleton, Sun Prairie, and Milwaukee. So high deductible health plans are a little bit of a different animal than our current plan. Under this option, the deductible would be $2,000 for an individual plan and $4,000 for a family plan. The reason we explored this option is because there are federal minimums that apply if you adopt this kind of plan, and those are indexed to inflation. So the minimum increases a little bit every year. And so by starting at 2,000, 4,000, that means we wouldn't have to increase every year. We're estimating it could take maybe 5 to 6 years before the minimum federal deductible would meet that mark, and the board would have possibly increase. So that's why we went a little bit higher than the federal minimum. Under a high deductible plan, everything except for preventive services, so vaccines, certain preventive drugs, your cancer screenings, annual physicals, those kinds of preventive services, those don't count towards the deductible, but everything else does, and that includes prescription drugs. All of the other features of the plan, including there's no co-insurance and the co-pays, those would be the same as under our current standard plan. The co-insurance, the co-pays, those are the things, and the deductible, those are the things people pay out of pocket when they use healthcare services. All right, so here's a little bit about a health savings account. So health savings account, they're a tax advantaged account. Any contributions to that account are pre-tax. And then as long as any withdrawals are paid for qualified expenses, those withdrawals are considered tax-free. You can use a health savings account to pay for a lot of different health, medical, or health, dental, or vision expenses, including your out-of-pocket costs like your deductible, your co-pays, but you can also use them to cover things that aren't covered in money plans. For example, if you need a new pair of eyeglasses, or if you need a crown and your dental coverage only covers part of that crown. So you can use it to reimburse yourself for a lot of different expenses. A health savings account can only be paired with a high deductible health plan. But one of the most important things, or one of the things that employees really like about a health savings account, is it's their own account. And they can use that, or any balance that's left over at the end of the year, it stays in that account. And so don't use all of the money in there. You can build up that balance over time. Okay. Also, if you leave the district, that's your money, your account. you take it with you. Okay? There are some different requirements regarding Medicare about for example, you can no longer contribute once you're on Medicare, and it can only pay for certain premiums under Medicare. There you go. So in putting together the estimate, which I'll share with you in a moment, health savings account, we assumed the district would contribute $1,000 for anyone that chooses this plan, if they're on an individual plan, or $2,000 for family. So that would cover half of the deductible. Okay. If they didn't use that amount in the first year, that would carry over, and then they get another 1,000 or 2,000 the second year. So all of a sudden now you've got a health savings account that could fully cover any deductible costs that second. Okay. We assumed that MMSD, this would be available to our non-Medicare retirees, but we assumed that the district would not contribute to that for retirees, but we could allow retirees to deposit a portion of their TERP payment, the Teacher Emeritus Retirement Program. That's a program where the district pays for 3 years, a dollar amount. They get paid monthly as a condition of being a teacher for a certain amount of time in the district. So they could deposit a portion or all of that for their HSA if they selected this option. We also assumed that new hires would get a prorated amount that first year. So for the budget, we had to make some assumptions about how many people, once this was available to them, about who might participate. If 210 employees participate in the next school year, we're assuming that would reduce district costs by about $1 million. The reason, and that comes from a couple of different things, but that's only for half year. Again, because this is a deductible change and deductibles run from January through December, it would only be a half year savings in the first. But in the second year of implementation, those cost reductions would double. Okay. The estimate assumes several different factors, including the premium. The overall premium from our health plans would be significantly lower. The employee would have a lower share of premium as an incentive for them to participate. The district will also incur costs because they'll be depositing money into people's health savings accounts. And then there would be a small administrative fee for the cost of administering those health savings accounts. Again, that cost reduction, we expect to double in the second year. And normally when such plans are offered as a choice, participation tends to increase over time as people will have to do a lot of education around this plan. And as more people start to use it and share with their colleagues, you start to see participation increase. And we would expect the same thing in the district if the board decided to go this way. This slide lists employee incentive. Again, that there's going to be a higher deductible, but there are incentives for employees, or certain employees, to participate. It's not going to be a plan that is in everyone's best interest, but for some employees, it might make sense. And that's because of these reasons here. The overall premium is lower. The rates that the plans quoted us were between 26% and 28% lower than our premiums for our standard plans. Also, the share of that premium is going to be lower than the share for the standard plan. Also, some individuals like that HSA contribution. That's additional compensation that would be available for them that they could use over time to either pay for their out-of-pocket costs or cover other kinds of expenses. And then again, that employee ownership of that health savings account can be very appealing to some employees. And again, balance carries over year to year, and they can take it with them when they leave the district. We wanted to share an example of what this might look like. So this slide shows what a monthly premium would be under both options for a teacher. So currently, teachers pay 6% of the premium for the standard plan. Under this plan, they would pay 3%. You can see the differences in the rate on the first line there. That's the total premium that the health plan would charge us. So under our standard plan for one employee, not a family plan, but an individual plan, the premium is about $1,100 a month. Under a high deductible health plan, that premium is $793 for a difference of almost $302 per month. The middle line there, that's the district costs under both plans and the difference. And then down there on the last line, you can see that for that employee, under the standard plan, they would pay under our current premium shares, you know, the 6%. That employee would pay $65.71 if they elected the standard plan. But if they chose the high deductible health plan, they'd pay $23.80 for a difference of about $42 a month coming out of their paycheck. This is a timeline of the communications if the board were to adopt any of these changes. Now, this timeline, we normally follow this kind of timeline for communications, even if we don't make plan changes, because we have to communicate with people about the overall change in any premium rates. So we do all of these things anyway, but as part of this, if the board were to make some changes, we would have to make sure that we're incorporating those changes into all of the different content. So we use emails, we use our employee newsletters, we do new educator orientation in August. We also, starting in September, as we're getting ready for open enrollment, we have lots of communications that go out. We do virtual education sessions that we invite individuals to. We'll invite our retirees to. We also communicate with some of our special populations that don't normally get, say, our district emails or district newsletters. So retirees, people on leave of absence, and our former employees during COBRA, we'll have to send letters to all of them, informing them of the changes. And then, of course, once we're actually in enrollment, a variety of communications go out to people, letting them know about any. If the board is interested in making any of these changes, in particular, the employee share of premium or adding an option for employees to select a high deductible health plan with equal pay, we would ask that the board adopt those changes as part of its regular board meeting later this month on the 27th, and then direct the district to make the appropriate changes in the employee handbook. And the reason that date is important is because we need to start communicating in May, because we pay health insurance a month early. So that first paycheck in June is the first time employees see a change in their paycheck. So May is a very important time for us to get ready for any changes that might be. So that's why we would ask for a board resolution, the April 27th meeting. Should I keep going?
Yeah.
Okay. Dental, this we talked about last time, so this is current state. We have the two different options. This shows where our active employees are as well as our retirees on our dental plan. 95% of our employees choose our base plan. We're expecting to spend about 3.8 million. The district's budget will spend 3.8 million on dental insurance. This would be the result of adding the evidence-based integrated care program and reducing the X-ray coverage. Both of those changes are cost neutral together, but they reflect what research really shows is providing the best dental care. And it would also reflect a 6% rate increase. That 6% reflects the inflationary trends that we're seeing in the dental plan. And there is also a small administrative rate change of 20 cents per employee per month. That is the first time we've seen an increase in the administrative costs in 3 years. And this is a summary for all of the employee insurance benefits. The health insurance options there, we put the district's cost, both if the board doesn't make any changes to the plan, as well as if the board does changes that we're talking about. We talked a little bit about dental, long-term disability, which the district pays 100%, is also going up by 15%. And there are no plan changes to our life, short-term disability. I think that is it.
All right, thank you, board member Vandermeulen.
Certainly, let me lower my hand. I'm gonna speak first as an individual, then as a board member. As somebody who spent the past year and a half trying to get my Medicare back. Because I took a job that paid $66,000. And it has taken me a year and a half to try and get benefits back. I know how difficult that this can be. It can be incredibly difficult, the number of hours that have been spent filling out the paperwork, etc. I worry about that at our staff. Number two, we already see in the high risk that it will, and the not high risk, on the savings account, that if you're on Medicare, you cannot save. So we are now going to be discriminating on any of our employees who receive Medicare. Anyone with a chronic disabling condition that receives benefits will not have the ability to have a health savings plan. That's the way the law is currently right now. Don't have to like it. I'm just saying how it is because I've tried it. And it's incredibly problematic. Additionally, and I can also share this with everyone, American Medical Association has stated, and I want to read this directly, permission, Chair, I'm going to read this directly, but the National Institute of Health actually did an entire study on the cancer survival risks for people with long-term care. It says, question is being insured by a high deductible health plan associated with survival among cancer survivors. Findings in this cross-sectional study using nationwide data from 147,250 respondents, high deductible health plan status was associated with worst overall survival and cancer-specific survival. I'd rather not kill our employees. I really, really worry about that. I'm not trying to sound like an absolute doom and gloom. And the reason why I understand people say this is a choice until it isn't. I've seen this before where it goes from a choice to then we have plan design, then we have rate risk, then we have people who aren't accepting. Several states have done this and have forced almost all autistics in several states on the East Coast into high risk only health insurance if you are autistic. Well, that's me, and I don't know how many else of our employees that is, but given that it's 1 out of every 31 kids currently, and we have 25,600 students, if you do the math, that's quite a number of kids and their parent. I worry of those whose parents work on staff. And most importantly, I want to protect our most vulnerable students. So I'm going to wrap this up at our most vulnerable payees. Option 1 is good. Option 2 is probably better because it protects for the lowest employees. But the high risk savings account plans, one, every staff I've talked to, including unionized staff, has been very negative on it. 2, I believe it harms individuals with disabilities. And 3, I just don't think that's in the best interest of this district. So I urge my board to focus on either option 1 or option 2. Thank you, nothing else, Chair.
Board member Nichols.
Thank you. Thank you for doing the work to plan out a second scenario with the lower percentage increase for the kind of lower paid employees and then skewing the other positions up to the 3%. I appreciate seeing that and I could see how that could be a doable plan. Where I want to focus on is the high deductible plan. So I just want to confirm based on what I remember from the last update into this is something an employee would select for themselves, correct? And if the employees who might be attracted to a high deductible plan are employees who typically wouldn't have, based on everything I understand, like they probably wouldn't have more chronic health issues, they would be better served with like our traditional plans, right?
That's what you typically see.
Right,
is
okay.
People that don't expect to have more than minimal healthcare claims would be the ones that would usually sign up for this kind of plan. Or those individuals who really are looking for a cheaper premium option, the premium being the part that comes out of their paycheck. We do get interest from some retirees that are interested in lower cost options.
Mm,
But that's really because they're paying the full cost of the premium.
Yeah.
And it's just, I mean, it's pretty significant, what the full amount of the premium is for an individual to, or so if you're otherwise healthy and retired and you're looking for a lower premium, it might make sense for those people. And if you don't, and again, it has to be up to each individual person. We will educate, but it is certainly a choice. If the district, for employees, if the district is contributing to that HSA, and the employees themselves can also contribute to an HSA. And again, if you don't use it for a couple years, you can build up an account balance. And then maybe if you use it, say the third year or the fourth year, you might have a balance in there that can really help offset that deductible, that higher deductible amount. I do think that there are certainly some versions of a high deductible health plan that have you can have a pretty high deductible of, 5,000, 10,000 is not unheard of
mhm.
for some employers. Here, we're really trying to get to the lowest option that's available. Although not the absolute lowest, because again, we don't want to have to increase the deductible every single year. But this one is pretty low compared to some of the other options out.
Okay, thanks. So I just wanna, so there's a couple of things I guess I'm wondering about. For the employees who might say, oh, I can go with this high deductible plan, my premium is less, I'm pretty healthy, I'm gonna try this. Are they locked in beyond the first time they say yes? Or can they, during the next open enrollment, could they say, I didn't like this and I want to go back to like the traditional plan?
Sure. Every open enrollment, they would be able to switch back if they decide it's not for them. They keep their HSA though, and any money that's in there, they could continue to keep and they could use withdrawal, for any out of pocket under the current plan, or like I said, other additional, you need a pair of glasses or contact, or dental crown. It would be
Right.
available to them to spend. So they keep that HSA even if they switch back to the standard.
Okay, great, thank you. And then just in some of the reading I did about high deductible plans, I'm gonna just roll these all into one and then maybe you can just kind of address it. So some of the disadvantages of a high deductible plan is that sometimes employees are reluctant to seek more of that preventative care early on because it doesn't really go towards the high deductible. That chronic illnesses oftentimes are better covered with a more traditional plan. And that sometimes even after employees have met their deductible, there could be additional specialty care or other things that they might need that still would require them to have to pay out of pocket. Do you know, can you say if this high deductible plan, like who is it provided by? Is it by both courts and, so they each have their own version?
Yep.
And then is there language or specificity that would be shared with the employees about like what all is covered and what might not be?
So the high deductible health plans, they have to meet the criteria for an employer sponsored care under the Affordable Care Act. So they would have to cover all the same services that our standard plan has to. That includes, preventive care, specialty care, emergency care, OBGYN services, all of mental health care, even children's eye exams, all of those would continue to have to be covered because they would have to meet that criteria under the Affordable Care Act. The issue with preventive care is when these plans were first created, and I believe they were created under the second George W. Bush administration in that time period, so early 2000s, I think, when they were first created. Preventive services were treated like all other services, meaning, yes, you had to meet the deductible first before they were covered. That has since changed. I don't remember exactly when that changed, but that has now changed so that any preventive services and the federal regulations define what a preventive service is. Those are covered without any cost sharing under any plan, whether it's a high deductible health plan or a standard health plan, those are covered without any kind of cost sharing. With the high deductible health plan, once you meet that, and this is something I know not everyone understands the deductibles terribly well. Once you meet that deductible, that's when the plan starts paying. So your costs would be covered for any services under the plan, except for those co-pays that were on the slide earlier, which is it's $20 for an office visit, but only for adults. And then there's the pharmacy copays and $150 ER visit. So the health plan will cover after the family meets, the individual or the family meets that deductible. And then again, as far as chronic services, those would continue to be covered under the plan. But again, if you expect you're going to be going, if you've got procedures coming up, you have to, some people go into the doctor once a month or whatever it might be. This might not be the best plan. And we certainly would have to educate employees about all of these things, but making sure everyone understands you can still go in and get your preventive care. Your pharmacies, your pharmaceutical costs, you may be paying full price initially. But again, when your pharmacy costs contribute to the deductible, that just means you reach your deductible all that more quickly. But it just can be a shock because under normal, more traditional health plans, pharmacies usually count towards the deductible. So it would be a change that we'd have to make sure we're educating people about. But before people sign up, they should be thinking about what kinds of healthcare costs do I think myself or my family, whether it makes sense.
Yeah, I mean, I do appreciate the fact that like this could be an option that employees themselves assess, like, is this something I want to do? And I do appreciate the of contributing to the health savings account to like make it more doable to meet that deductible, because it is a shift. So I appreciate the kind of the thinking around that. I think the one thing that's hard is, a lot of times sometimes you don't know that you're going to have a health issue. You think you're going in for a regular checkup and all of a sudden something is detected in your blood work and you're this. I had a pain here. I thought it was a shoulder, and now you find out it's something else. So I'm just trying to figure out for an employee who we all have, I mean, there's only certain amount of things that you can know about your own health until you're dealing with something. So for the employee who said, oh, I like this option, I think I'm healthy, and this could save me some money, and I'm gonna lock into this, and MMSD is contributing, and then let's say 3, 4, 5 months down the road, they're like, oh my gosh, I'm having an unexpected health incident. Are they then gonna have to still pay like more out of pocket to get to the deductible threshold?
They would have to meet the deductible in that current year.
Okay,
And that will be a choice that the employee would have to make.
Yeah.
Because, right, unexpected things can happen to any of us. And the question, the balancing act, if you will, is if that happened, right, could I cover that cost versus how much less I'm paying in my paycheck every year for that health insurance? And is it worth it to me? And those are the choices that employees that are interested in this would have to consider.
okay. And then lastly, there are also employees who have access to healthcare, are paying for it out of the traditional plans in their paychecks, and sometimes don't go to the doctor at all. You know what I'm saying? Like, it's just it's like a whole year's gone by and you're like, oh my God, I've had like scheduled doctor's appointment on my to-do list and I still haven't done it, right? And so, but you're still paying
Yes.
every month for a plan access that you're not accessing, so. Yeah, I understand there's
And that actually,
trade-offs.
there's a pretty big proportion of people, I can't quote off the top of my head, but it could be anywhere from 40 to 60% of people on the plan don't use. And I know when I first started talking with the board, we talked about the 80-20 rule, which is the idea that 80% of the costs are coming from 20% of the individuals and vice versa. And that's because
Oh,
some people have a lot more needs and some people, they don't. And they don't use healthcare. One of the most important things and one of the good news, some of the good news with our plan is we do see a very high utilization of preventive healthcare
okay,
by our employees. And again, that's, you know, the health plan's paying for that, but they are not paying anything out of pocket for that. So we do see a high utilization of preventive care, but we would want to make sure that that doesn't change for employees that are high deductible.
yeah, agreed. All right, I appreciate it. Thank you.
Thank you. Board Member Saravo.
Thank you, Chair Castro. Okay. I just wanted to lead with that I believe affordability of care and not just access to a plan matters really deeply here, especially for employees who have chronic or ongoing health conditions. So we've talked about this several times already. Have we done any analysis on how changes affect employees who have chronic health conditions or ongoing healthcare needs?
You mean in terms of a high deductible health plan? Or
How they're impacted when you make significant changes of what they have access to? What is, who's gonna be using which type of plan? Who does that benefit? As we talked about, board member Van Uren talked about what is a healthy person?
Mhm.
And I know I brought it up before. Have we done any analysis on that?
No, we don't have that kind of data. What we do know is the individuals that tend to select a high deductible health plan tend to be those individuals that don't expect to use a lot of healthcare. We would have to get more data from the health plans to understand anything beyond that.
I like how we board member Van Uren also use a little bit of like personal experience. I have a spinal cord injury because I was in a car accident when I was 18. I was lucky to have purchased health insurance because it covered hundreds and thousands of dollars of ongoing care for a very long time. So I understand the value of going that way because then you're going to have healthcare for a long period of time and long-term disability kicks in. There's so many things you can become thankful for down the road that really support you when you do have significant things like that happen to you, whether or not you're at work at the time. Other part I wanted to ask about is there's been some analysis on like how competitive we are with the other districts surrounding us. Is this modeling? How does this compare to what the other districts have?
So we know other districts, are you talking specifically with regard to a high deductible health plan?
I think healthcare in general, do we know what they do? Because we're rich in healthcare places and access because we have many hospitals and lots of clinics here.
Yeah, we do have, we know that a number of other districts do offer a high deductible health plan option. Middleton and Sun Prairie, we've identified in this area. You know, in the rest of the state, there are certainly plenty that do. I know Milwaukee does as well. With regard to the premium share, we also know that our employees on average pay a lot less as a percentage premium compared to other school districts. I believe Verona, for example, if you participate in their wellness program, you can pay 11%. Don't participate, you can pay 13%. I've said 12 is very typical, but it does vary a little bit by districts, but the 12%, the 10 to 12 is more typical in Dane County. Besides us, I think there's one other district that pays less, but pretty much everybody else I've looked at pays in that 10 to 12% range.
Okay. You know, retention and comparing us to other places. I think healthcare is something that people think a lot about when they, the benefits when they're looking at where they're working. I didn't see anywhere in here any feedback that we got from MTI, things like that. Was there?
I have a text.
Sorry. So we have been talking with them about these options. We started last fall meeting approximately monthly. My understanding is that they wanted to make sure that if there was a change in the premium, we maintain that tiering that we do now, where the lowest income employees pay the least. At least that's what they expressed to us. And then also the issue of a high deductible health plan choice, that might be something. I don't want to put words in their mouth, but they suggested that choice might not be bad. But that's what they shared with us.
Okay. I would have liked to see that in slides, because I think that's really important to have that kind of direct conversations for us to understand where that is. And we have 7 slides on that, so if we're continuing to do that, I'd really want to see that in the future. I did a little bit of research on the high deductible ones as well. And I was looking at some studies done from Harvard Medical School that talks about the impacts and potential the impacts that it has that causes skipped or delayed care, which is kind of I remember Nichols was it's kind of referring to like what happens within that space if you don't get healthcare and kind of, or what kind of preventative care I think specifically used. And I think, and they found that it increases long-term costs for employees, potentially the district, because people are not using it for either preventative or ongoing, like making sure that they're staying in contact with our healthcare providers. And I'm also wondering, like, depending on which one we go with, I know that our analysis of the compensation study is going through like job descriptions. I do assume that the couple that are in here are going to get more broadly defined. There's more that goes into that. Like there's a couple that are kind of like there's parsed out as to the lowest employees versus the highest employees. I'm assuming if there's like more under there, there's going to be more of an understanding of like who lands under which low versus high, or is that just kind of the base model that we're working with?
I'm not familiar with the study.
But compensation as a whole package is something that we are working on with Evergreen, who was the selected vendor for the compensation and classification. It isn't, the benefit kind of lives outside of the position descriptions, but we do have information on the website that says which employment category.
I was wondering if it would merge well once we receive job descriptions and where they end up. If that was be a fluid, if they were gonna be able to tell where we're gonna land in that category, if we go with that one. And maybe that's not an answerable there.
Can you clarify the question? Because we do have information on our website that shows like the EAs pay, these are the premiums for EAs, food service, security assistance.
I was wondering when there's more defined job descriptions that I thought it was talked about earlier, that those were gonna, because of the study, those are gonna be more defined and they're making for categories. Will that affect the categories that are listed here right now, or how are the two gonna talk to each other so people know where they land?
I guess I'm not sure.
To be determined.
That's probably the best answer. If there are, the categories that we have are to a certain extent tied to the handbook.
Okay.
So I don't know if that's where this study ends up going, if it, changes definitions, based on what's in the handbook right now.
Correct.
Yeah, we just don't know.
And to clarify, we're not thinking about changing of any of the employee groups. That's not what we're doing
Mhm.
with the compensation, the classification study. Like the whole piece about like, some places call it total rewards and include their benefits in there. I mean, that's, we want people to hear about that, and that isn't necessarily in their position description. That is a total reward statement that we're not currently providing to employees, but we could certainly look at doing that at some point in time. But we have to also look at how our systems have that information stored so that it's not a manual process. But
Yes, okay. Thank you. I had a question in the dental. Did we cover that in here, right?
Yeah.
Okay. There was a piece about overexposure to radiation due to. I can't remember now. I'd have to pull the slide back up. I'm wondering, that seems like a change from before,
Yeah.
right?
Can we, do you want to pull the slide up? Yes, there were two changes that we mentioned, that would be, added to the I think. Nope, down, this one? Yes, thank you. Kind of small, but, there we go. So there are two changes that we're proposing as part of this. The first one is, it's adding the evidence-based integrated care plan. So this is a plan that, or benefit, an add-on to our current plan that will essentially provide more services. Usually it means, cleanings and whatnot. Sometimes it involves fluoride treatments for people with certain chronic conditions. Those chronic conditions that are, for which this is available, it's based on research that has shown, oral health disease can have an impact on the outcomes for those conditions. So it can include some cardiovascular health, some cancers. Been a minute since I've looked at the list, pregnant women. There's about 5 or 6 different conditions for which there is a lot of research that supports those individuals getting more dental care throughout the year, so they could get it. Most of dental's employer groups do include this benefit in their benefit package, so that would be added. There is a slight increase to the rule that would be for the most part off by changing the amount of X-ray coverage that's available under the plan to what is currently recommended by the American Dental. So the American Dental Association in 2024 and 2026 did a thorough review of their guidelines, a number of changes, because it looked at the amount of radiation that patients received when they were having multiple X-rays, twice a year, basically. What benefit that provided compared to the impact of that additional radiation. And they said the benefit was not worth that increased exposure. So the American Dental Association changed its recommendations. So now they're basically recommending just one, bite wing X-ray a year. And then they changed the panoramic, which is that kind of full mouth X-ray. Yeah. So the change that we're recommending is to add that evidence-based integrated care and to conform the dental plan's X-ray coverage to what the American Dental Association is currently working.
You're saying this is modeled under what dentists are changing their practices to?
If they're listening to the American Dental. Yes, and I do think, I have heard from some people that their dentists already, they're not doing the additional dental coverage or exams because that's not currently covered. But there are a lot of dentists that are already scaling back on the amount of X-rays that they're already doing, but not all dentists have. So with this coverage, we would love to see that with our employees.
That's what I was wondering, because it almost looked like insurance shift, and I wasn't sure if it was like a practice shift. You know what I mean? It almost seemed like one where they disconnected from each other. What happens if they tell you you need one, and then they said you can't do it, and then it's more based off not what your doctors,
In the healthcare space, I believe it applies in the dental space. When the practice guidelines change, it can take years for doctors to adopt practice guidelines. Some are more, changed more quickly. But I've heard anywhere from, 5 to 20 years for, the practitioners to actually change to what the guidelines are.
How do we know what impact like that piece will have over time, since that's be a change in the, or maybe
We are self-insured for dental. We can get, not individual claims data, but we do get delta that help, we can look at utilization. I think as far as actual outcomes on health, whether it's, pregnancy or cardiovascular or cancer, that we wouldn't be able to see because our dental plan is not going to have that. That would be our health plans, and we wouldn't be able to tie those two together to know.
guess I'll be watching ongoing what changes or what feedback ends up being with that in there. I guess overall, I'm gonna finish with, I'm supporting the shared option. I cannot find myself supporting a high deductible model. I think if we're serious about equity, retention, and workforce stability, access to care has to be real and available to people and not conditional on whether it's afford to use it. I think when care becomes unaffordable, people delay, skip it. And that ultimately leads to worse outcomes and higher long-term costs for both employees and the district. Where I'm at. Thank you, Chair.
Board Member Moser Logan.
Thank you, Chair. Thank you. Hi, hello, hi, team. Thank you for all your work on this. I'm also in support of changing the employee contribution percentages in option 2. I have just a couple of questions about the proposed action. Can you, Rachel, I heard you say something about how the timeline is like that June 1st is the first month in which employees would be paying, or, sorry, Jennifer, did you say it?
So
Can you repeat that about how the timeline, you imagine the timeline working?
sure. So for health insurance, we and employees pay a month ahead of time.
Right.
So any change to coverage for July would come out of June paychecks.
I understand. Got it. Okay. And that's the case even though, but that's just because people's insurance goes through the summer, even though the new contract for the 2027 school year doesn't start until August, and that's just how it is. Okay, okay.
You're based.
I wanted to just make sure I had clarity.
And I add? It will change because the premiums themselves are going up regardless.
Right.
They will see a change regardless of whether the board adopts a change in the percentage.
And then to make sure I understand, your sense that people would have an interest in a high deductible plan is based on what's happening elsewhere? Okay. I'm not 100% on that. And I really appreciate the discussion from my colleagues around it. I have other like kind of hyper detailed questions about like if we want to take action, what that resolution would have to say and why and all of that stuff, but I don't know that's important for right now. That's it. It was just making sure I understood those little bits. Thanks.
Okay.
Yep,
Thank
that's it for me.
Thank you. Board Member Vandermeul and then Board Member Muldrow.
One FYI, board members check their email, MTI. Number 2, on the high risk healthcare. Number 2, I'm worried and have a quick question. I have heard, and I do not know if this is true or not, which is why the question that UW Health is pulling its student-based mental health support in East and La Follette. Is there a way we can verify that before we make any resolution on healthcare? As if they're not providing that, what else are they not providing to our district? I really worry about that.
Board Member Vandermeul, and I'm not sure if that meets the notice for what we're talking about tonight through the agenda. But that's certainly something that we can talk about as a body at the appropriate time.
I appreciate, it matters to my vote is.
Yeah, absolutely, and we have time to discuss that prior to the ultimate vote.
Sounds good. I appreciate that, Chair. My other comment that I am concerned about is that I don't know. Is again. That our employees are truly going to understand the difference. And this is one of the I have a lot of it. This is one of the most complicated topics I have ever seen in my life. I have had to read one page 15 times to be able to understand that, and that is with a law degree. Do you believe that our staff are truly making an informed decision with they could have a college master's, etc., but without a law degree, is that even possible? With how complicated these plans are. And that's all I have to say. Thank you, Your Honor. Thank you. God, I said Your Honor, wrong slip. Not Courtney. Sorry about that, Sabian. So you would be a good judge.
Thank you.
So insurance is difficult, regardless, whether we're talking about a high deductible health plan or any others. We do certainly, and we're not alone. Our employees are not alone. That's a universal truth that insurance is just difficult for a lot of people to get their heads wrapped around. I think when we explain it to people, I agree, reading, there's a lot of language, it's different language than people are used to speaking. But when we walk people through it, a lot of people do understand those choices. I think, for example, new educator orientation is a great example. We're there's 3 of us sitting there and we've got people lined up to come and talk. And we walk them through their benefits and explain the differences. I think for understanding, I think that is definitely important. And it's a level of service that we do provide at new educator orientation. We do also do a lot of as we get ready for open enrollment, we do a lot of virtual sessions where people could come and they will present, will answer questions. I think that interaction certainly increases the chances people will understand. But I certainly do understand the challenges as well when people are just handed an FAQ. It's tough. Yeah, that's good.
It is hard. I tried.
Yes, and we do have video also, so for people that
Oh,
can't
good.
come to virtual sessions, we have one on our website now that, just explains what is a deductible, what is copay with your premium, what are them. I don't know the actual clicks, how many people, but we did that video because we were getting so many questions from people that didn't know what those terms.
Thank you, appreciate it.
Thank you. Board Member Mulder.
Thank you, Chair Castro. Can we go back to the slide that showed kind of the original proposal to increase everybody by 2% versus the option of, yes, well, to navigate the last time we were here, in which we're increasing folks who make a little bit more by a little bit more, so that we can keep our staff who make the least pretty stable in terms of their contribution to healthcare?
A little more.
That one?
Yes, thank you. I think this table, I think initially when I started talking about this, I was really concerned about the equity and really the impact of inflation on the people who make the least within our organization. I actually didn't expect there to be a difference in like that column that is like 8.2 versus 8.6 versus I guess I didn't expect there to be any difference in terms of how that accumulated to create a savings for the district in relationship to healthcare. So I'm curious about whether or not adding 2% for everyone or adding that 3% for those 2 categories is kind of equal overall in terms of the cost savings related to the district. What the difference in those numbers.
But what we did, what I understood the request was that top line there, for the educational assistance, food security assistance, that category of employee. We understood that you wanted to keep that group at the 2.5%, what they are today. And then the other three groups, the teacher, custodian trades, professional administrators, that their percentage would go up by 3% from where it is currently. So overall, that does produce a little bit more of a reduction for the district. Which is why you see the 8.6%. That would be the average percentage across all that they would pay as a percentage of the premium, and then the district would pay the difference. So that's 8.6 compared to 8.2. So it does reduce the cost to the district a little bit more. But it
And doing it evenly across.
right, but it does increase then, as you can see, the amount of the employees in those three categories.
I'm comfortable with 8.6 because I think that still makes us tremendously competitive in comparison to most of the districts and honestly, most other government employers throughout the community. But I am curious, like, what that exact dollar amount is. So what,
So you
so
would
when
like
you
to-
say like in total,
Mhm.
this increase is gonna be I think you said 14.4 million. If we increase to have the average employee paying in 8.6% of their health insurance, does that change that 14.4% increase? If so, what does it change it to? Does this make sense?
Yes, it does. So we, sorry, Jesse, could you go back to the?
I'm sorry if that was already on there.
Yeah.
This is what you want, right?
So it reduces this is option one where everybody goes down by, or goes up by 2 percentage points. So the
And-
14.4 would be reduced by 2.1 million. So that would get you to 12.3. The next slide, please. So if 8.6%, it would go down by 2.6. So that would get you to 11.8, if I'm doing the right math. If you, well, there's another slide at the very end where I had the total amount the district would spend, but it assumed the board adopted the HDHP option,
Okay.
which I think it was 94 and a half. So it would be, if you didn't do the HDHP, it would be 95 and a half compared to 98.1. I know that's a lot of numbers, but
I did one.
No, it's
Or five without, or with changes.
And that's with option 2 plus high deductible. So
Right.
it would just, if you don't do.
so if we do option 2 without the high deductible, it's really this 2.6.
0.6.
Which takes us from 14.4 to 11.8.
Yeah.
That's almost $3 million. So I think that's really significant. And I want to point that out because I think a lot of us are leaning towards that option. I'm definitely leaning towards that option. And at the end of the day, I don't want to raise the cost of anybody's healthcare. I believe healthcare is a human right. And so I think if it wasn't that significant, I think almost $3 million when you have a really tight budget is pretty significant, is worth this adjustment. And at the same time, I think like it's hard for anybody when their life gets more expensive. And so I think trying to alleviate the folks who are making the least doesn't mean I feel great about raising the healthcare costs for other people. And I hope that we can be really considerate in how we explain this to folks and how folks absorb that additional cost. I think I'm open to the high deductible plan, in part because I think people have the agency to make really specific decisions about their healthcare. I do think there are employees, and I would put myself into this category of like a person who accesses a variety of healthcare that is never covered by insurance, and there's a lot of privilege in that. But I think if somebody was like, oh, I'm gonna end up paying out of pocket for this kind of treatment anyway, because that's my preference, I might not want to invest in this system as intensively. And so because of that, I think, you know, our employees are complex, nuanced individuals who deserve the opportunity to make real decisions about what works well for them. I do understand the critique of the risk involved. And so I want to hone in on how much a person would have to pay before their healthcare essentially kicks in. And so can you talk us through those numbers? We start in June. That means by the end of this year, so like by the end of December 2026, how much would a person have to have spent out of pocket before their healthcare kicks in?
So what we're proposing is for existing employees, this option wouldn't be available until January 2027.
Okay.
So nothing in 2026.
That's really helpful, because I was like, oh, it's not even a full year, you could
Mhm.
really end up just not hitting that deductible.
Yeah,
Okay.
yeah.
So,
It is very challenging to implement a deductible change mid-year. So that's the reason why we're not recommending making this available until January. Again, employees would opt into it during open enrollment. So in that first year, let's just use an individual, an employee that's not married, doesn't have dependent. Their deductible under the high deductible health plan would be $2,000. So they have an emergency room visit. Get a bill for $2,500. They would pay the first $2,000, and then the health plan would cover the remaining $500. They would have their health savings account, which the district would have already contributed $1,000.
Right.
The district or our current flex spending vendor, EBC, stands for Employee Benefits Corp. If you sign up for this, you would get that HSA account, the district would deposit the $1,000 in it. You would get a Benny card, which basically looks like a Visa card. You could use that card at that point with most providers. They have a credit card reader. You could use that benefit card. That would pay for if you've got $1,000 in your account, it would pay the first 1,000. And then that emergency room then would ask you to pay the remaining 1,000. They might have a billing
and then your
option.
coverage would take care of that last 500.
The last 500, correct. Now, let's say that happens, that emergency room visit doesn't happen the first year. Maybe it happens the second year. You haven't spent your money from the first year. The second year, you're getting another $1,000. Now you've got $2,000 in your health savings account. You go to the ER, you've got $2,000, pay with that Benny card. So nothing out of pocket, you're paying from your HSA, and then the insurance is going to pay that extra $500 to cover that $2,500 emergency.
Am I correct in saying that once you hit that $2,000 deductible, your healthcare is covered?
It is, with the exception of those copays, which the copays are the same as they are under a standard plan. So it's $20 for an office visit. It's $150 for the ER visit. I forgot about that. And then I think $6, $15, and $30 for. But those are the same copays. People.
I think that this is really important to understand, right? Because I think what you have a sense of nervousness about, or at least I have a sense of nervousness about, is like you get to you fall down, you get hurt, you break a leg, kid gets injured, it's an unanticipated expense, and it might be, $5,000, and it's good to know where that out of pocket, when we're talking about people in the first year, is $1,000, which is pretty comparable to like, even with copays, if you need a lot of care, it can get pretty expensive out of pocket just in relationship to that. So, I think that is a very comforting thing to understand in terms of how much this really could end up costing an individual, and what it looks like when a person cannot afford that. So that's my next question is, it's the first month, you break your kneecap, go to the hospital, you need to use that $1,000. What happens if you don't have $1,000? Like your credit card is maxed out that month, you haven't gotten paid since June. You are in that stretch where it could be really challenging for you to pay that amount. What do we do? Is that person ineligible for care at that point? Like, how does that work?
Most healthcare providers, I think partly by nature of the fact that they're non-for-profit, they have to have charity care programs.
Okay.
So, and usually when you're dealing with a deductible, that carrier may not know right away how much you have left on your deductible. So what would usually happen, this is not always, but usually what would happen is you would get a bill eventually. Almost all healthcare providers, especially if it's a larger dollar amount like that, are willing to work out payment plan for individuals. And if you're paying over time, the next year you'll get another $1,000. You can reimburse yourself then when you've paid more out of pocket as you accumulate a balance over time.
Okay, that's tremendously helpful. That's it for my questions. Thank you so much, Chair Castro.
Thank you. I just have 3 quick questions. Well, first of all, I want to say that I would favor the alternative HMO option where we hold the food service, security assistance and educational assistance constant at 2.5%. What level of counseling is available for employees when they select or elect their benefits?
So we certainly do talk with employees on the phone. They'll reach out to us when they have questions. We do a variety of virtual interactive sessions, so live sessions we would make available to people. And I would say in the 2 years I've been here, because we haven't really been making that many changes, we do get engagement, but it's not significant. I would say maybe of 3 sessions we do, we get maybe 20 employees. I'd be happy if 20 people signed up. We don't even sometimes get that much. But that's not unusual when you're not making a plan change. But when you are changing a plan, adding new benefits, whatnot, we're going to see more engagement on that. And we haven't come up with a number or anything like that, and not knowing what the board's going to do, but we would certainly offer more of those interactive sessions where people could come and ask their questions. And we'd also have to do, I think, videos for people that couldn't attend those kinds of sessions. Obviously, we'll make them available at different times, but not everybody would be able to come. So that would be the primary way. We would make sure that we're available live to talk to people and answer their questions. Again, as I mentioned to board member Vandermeulen, when you walk people through it, they're much more likely to understand the challenges. And so that will be a really important part of the education.
Okay, so there are like group opportunities, mainly virtual. There's a phone number they can call. There's the materials on the website on the HR page or HR portal for each employee when they elect their benefits. Okay, thank you. Let's say
We would also send out emails as well to make sure people had information and knew the changes were coming and invite them to participate.
yeah, thank you.
Yeah.
Let's say someone is going through medical condition, let's say they break their leg or they have something like that where they require maybe physical therapy, and that spans a year, and that spans a year or so, and they have an opportunity to change to a new benefit plan.
Mhm.
So let's say someone broke their leg in May, they can change a new healthcare plan in what is it, June or July?
October.
Oh, never mind. Okay. Okay, let's say someone broke their leg in August.
Okay.
And then they can change a new plan. Would they be able to receive care once they choose their new plan?
So,
Yeah.
yeah.
Oh,
So, a couple things. The open enrollment, right, that's when employees make a choice. That occurs from October 15th through November 15th. That's every year. That's just what the district has been doing for years. Any changes that an employee selects at that time would take effect January 1st.
yeah.
Okay. The assuming the person was on that plan, a plan, let's say our standard plan right now, and they broke their leg in August and they had that therapy. So any visits to that physical therapist would be covered under the old plan, it based on the visit date. So if they had a visit on December 15th, that would be covered under the old.
Okay.
If they have another visit, say January 15th, and we switch to the high deductible health plan, that first visit is going to be subject to the deductible under the new plan.
Okay, all right, yeah, I guess the spirit of the question is someone has an ongoing health concern and they choose to change plans when they can. The new plan, they won't be beholden to their old plan once they change their new plan. Yeah,
Not in that circumstance. There are sometimes continuity of care options, but that is, for example, if a provider left the network or something and you were in the middle of like a pregnancy, for example, you can't force somebody to change doctors in the 8th month of pregnancy, for example. So there are some continuity of care protections built in and required by law, but I think in the physical therapy situation, it's based on the date the visit occurred
okay,
in terms of what plan it would pay them.
so they can continue to have the care plan to address their health concern, but they could change the payment conditions after January 1. Okay. All right, thank you. Big picture, so the 17.3% increase, without changes, it costs 98.1 million to the district. With changes, it's 94.5 million. So, yeah, from the slide.
Yes, it's the 94.5 assumes that the board is going to adopt the option 2 premium share, the one that we've been talking about, and the high deductible option. So we're projecting that would reduce cost by another $1 if the board doesn't go with the high deductible choice.
It'd be like 94 or 95.
95.5.
Okay, so but the point here is that the district will pay the lion's share of this rate increase. Okay, thank you. And then big picture, what is the percentage on total healthcare cost, how much district pays and how much employees pay?
Long term, well, we would, if the board adopts this change for 26, 27, the board would have to change it again to change that share, right? That's a board decision. Are you asking about how much are costs expected to continue in the future?
No, I mean, let's say, just this year, how much was healthcare? How much did the district pay and how much did employees pay?
Oh, on average, right now, it's about 6.2% is how much employees pay, and then the district would pay the 93.8% on average across all employees.
Okay, thank you.
I have one.
Remember Vanderbilt.
I just want to correct something. According to the Emergency Medical Treatment and Active Labor Act, a hospital can refuse treatment if you cannot pay a deductible. It doesn't have to, the safeguards. The Prep administration removed several of them this year that were recently added back based on both citizenship, homosexual status, and ability if you have HIV. So just saying that, yeah, they can refuse. Nothing further.
Okay, any further questions? Yeah, go ahead.
Chair Castro, I don't have a question. And thank you, board member Banner. I think the hard part of where we are is that health insurance costs, dental costs, they're all continuing to rise. And I feel like the conversations I've heard of us tonight and even, the last couple of months as a board, how can we try to maintain the most robust coverage for our employees, trying to minimize the amount of increase. And I feel like we're working hard to do that. Like we, even in previous presentations, when there was an option to increase deductibles, like we weren't in favor of that, right? And so to board member Muldrow, your point, like nobody wants employees to have to pay more and the rate of increase is pretty significant. And so I think we're trying to figure out a way to deal with that increase district-wide and also, you know, try to make any increases for employees, you know, modestly and honoring that tiered approach. And then lastly, I'm not saying that we're all on the same page about this. To me, I feel like what I hear in the conversation about the high deductible plan, it's an option. It doesn't mean employees have to select it. They can choose to, if it works best for their life. And so to me, because it's not like it's replacing one of the health insurance options, it's not forcing employees into it. They could try it and then decide in the next open enrollment, this wasn't for me. I don't like it. To me, it feels like it's another thing that adds to the robustness of our health insurance options. And it's not gonna work for everybody, but for me, I think the fact that the district would be willing to say, we're gonna try to make this a little easier for you if you choose this by putting money in a health savings account that goes towards your deductible, I think is the right move if we're gonna go with that option. Because it makes it easier for the employee to make the adjustment.
Can I ask a question?
To me?
Yeah.
Sure.
What about those who don't qualify because they're on Medicare and can't put anything in the and the health savings account because they're not allowed to?
Yeah, I would say they shouldn't choose it.
I'm just saying that.
You know what I'm saying? Like,
Yeah, I'm
I
just
think
saying.
I hear everything that you've said tonight and I appreciate everything that
Right, I
you bring to the
appreciate
table.
yours, I just didn't think of that, so I just wanted to know your view.
Yeah. I would say. I would have been concerned if the district said like, we've calculated
Got
that
it.
40% of the
That
employees
makes
are
more
going with the
sense.
high deductible, then I'd be like,
Okay, that's
starting
what
to
I
sound
didn't
like,
understand.
you know, like, how did you come up before? It? But because they said we're calculating 210 employees might try this.
That makes more.
To me, that means the majority of our employees, what I'm hearing, are like, they're gonna stay with the plans they already have. And it's maybe a small number of employees who are like, this would work for me.
Got it.
But because it's a choice and an option, not a forced thing,
Now
that's
get
why
your
I was
position
more
better.
in support of it being like, oh, that might be something nice to add.
I appreciate, I'm sorry, Chair, I just wanted to understand everyone's position
Yeah.
better, and now I do, and I really appreciate it. Thank you for explaining that.
Yeah, no problems. Thank you, Chair.
All right, thank you. Seeing no other questions, we can move forward to the facility referendum update.
Excellent. See the Director of Facilities, Scott Piak. If we can give a referendum update on referendum 24, which is moving quickly. And then Assistant Director of Transportation, Vanessa Cruz, is going to give a pretty thorough update on transportation. Team has been working very hard.
Great job,
Both presentations will
great job.
great report.
All right, thank you, Dr. Gothard. So tonight we'll do a quick update on 2024 referendum, then I'll tie us into Vanessa. This month will be a little short information on Ref24 as we continue to work through the designs on phase 2 and also getting the final numbers on phase 1. So here is just a little bit of a general update where we are in phase 1. We are currently in construction, if you can't tell. Lots of stuff happening, lots of dirt flying around, and the rain's not gonna help us this week, but we'll continue to make some good progress this week. If you haven't been out to some of the sites, Blackhawk Iris has walls being poured. Sherman Shabazz has got the piers finalizing for foundational work coming soon. And we are starting phase 2. So not only do we have phase 1 fully in work, we are deep into phase 2. We have started to see some of our schematic designs come to fruition. And we are just turning over this week to our detailed design drawings to start going through what we liked in the first part, work some curriculum staff. Now we're diving into what the next set of schools will look like. So we are going into a little bit, we'll skip one slide, we're going to upcoming work So we are meeting with principals in the next coming weeks to talk about what their individual schools need and how they're shaping those designs in the buildings. We are currently now starting the UDC process on phase twos for Senate and Cherokee. Those actually are Wednesday night. To start that kickoff phase for phase two, those two schools. Shortly trailing thereafter is the Tokyo Orchard Ridge site. Where we will have the site work, changing up where the school is going to be in location, the tight constraints that we have at Tokyo Orchard Ridge. And we're going to be changing the zoning to be a 3-story school. So lots of different things will be happening there on that site. It is a very tight and constrained site. You think it's the largest, but forest that we don't want to disturb. The existing school on site, we'll do some creative things. I think you'll be very, very how that site is coming along. Also in phase, on some of this work in April we have coming up is all the final details. Phase one, we are preparing the final quotations that our CMs are doing great with our work. We should be coming forward in the month of May for the GMP for the first 2 sites on phase one. I can say we're doing fairly well on our financials at this point as coming forward, and we'll be seeing those numbers in May. As you will see in the GMP, and we will start the presentation of our books for each site for new updates on pictures, programming, spend to budget to partner. So those will start to really come to forward on it. Pretty excited to see that work coming. As I mentioned in May, we are going to see the UDC process. We'll then start the process for Ridge site. A lot of community engagement coming up at the very end of May. Coming into June, as we start to really dive in with our staff, our community, and our principals, what phase two schools will start to shape and really look like. I will share the previews to you at May Operations Work Group of what we've come up with so far as they'll shape. So lots of work and activity coming ahead. Pretty excited to show off what we've got. We have a little video thanks to our comms team. I'd like to share this out for you guys to see if you want to click that for me.
We are here today to do a public groundbreaking for the Sherman Shabazz School Project for the Madison Metropolitan School District.
We are so excited on this beautiful day to be breaking ground here at Black Hawk and Coppers.
They're important because the community decided to invest in public schools, number one. Number two, our students deserve the very best. We've had student engagements where they brought forward ideas and really put effort into making sure this happens for them.
Something I want in the school is definitely like AC, because we also we didn't really have it, and that was really a bad time, especially in the summer.
I'm glad that the younger students, as in 6th graders, get to have a whole new school and a whole new learning space. I think it will really help them stay focused, just overall have a better learning space.
Learning has changed a lot. Teaching has changed a lot. The fact that these will be flexible learning spaces that are able to adapt with class to class with different technologies that might come our way.
It shows the community's commitment to investing in our schools. Our students are going to have a 21st century facility to explore, to learn, to find out about themselves.
This is so exciting. Vogel Brothers has been a member of this community for 150 years, and to see everybody come together to build a project that will have long-lasting impact for everybody in this community, including our children, the educators.
The rocks you see in the loader behind us, they will actually be placed into the foundation of the new building. Each rock represents hope, dream, or vision for the future, for themselves, for their school, and for their community. As a Madison company, 136 years in business in Madison and working for the school district with over 1,200 men and women that work for Findor. It means a lot to us to be part of the district. So it excites me that Madison Metropolitan School District is getting the improvement in the facilities that it deserves.
We'll be moving in right around August of 2027. So we're about 14, 15 months away. Thanks to our partners in this work. What they've done has been amazing. It's been very fun to see that happen for the city of Madison and the students. It's a great day to be part of the Madison Metropolitan School District. Days like this don't happen often where we can come together and truly celebrate with our community.
So indeed, it was a great day, exciting times. We were in perfect weather for it. Don't expect anything better weather than that.
Right.
We tried really hard. There's a couple pictures in there for you to enjoy in your own time. OPN did donate some models. You see on the bottom left, they are 3D printed models of our schools. of the new designs, and we're gonna be looking to hang them up in the existing schools that they have, so our students really can experience what that new school will look like on the grounds, as they start to see it kind of shape. So Oakland did a nice job donating to us. Sonny, you'll see the Dream Rocks, they are about ready to be put in the foundational pieces here in the next week or so. So it's kind of exciting time to see that come forward. And then next month, we'll talk about a little bit of sustainability piece of these schools, as Brianna and Mike McDonald will be here talking about sustainability and long-term actions.
Nice.
The award that we achieved last couple weeks with Dane County. I haven't put it on the slide deck, but mark your calendars for October 14th this year with Cherokee and Senate's groundbreaking ceremonies. Their kickoffs, and Tokies will follow following spring. As that building's just a little bit behind the other ones, a little different timeline. Let's see, I got my slide. Budget updates. Currently, we're about $9.4 million to spend to date. A lot of it's still architectural work. We're just finalizing the notice to proceeds for all the subcontracting work. So again, the costs haven't started to roll in yet, but we are going to be purchasing items shortly with our contractors. We'll see the numbers grow, start to see foundational pieces. Those bills haven't started to come for another week or two, then you'll start to see concrete bills coming. So always a little bit behind when it comes to the billing and budget side of it. Hey, with coming, we'll go locked in here to maximum price and start to see the booklets, percent of completion to cost of money spent. It'll all come to fruition as we start to pull this all together. Okay, I would say if anybody out listening and fans outside, please take a look at our Let's Talk. If you have any questions on our sites, what's happening in our district, referendum based, reach out to Let's Talk and go to Referendum. That stuff comes directly to myself. We try to get everything responded within 24 hours, and have our design team as well for any challenges that they may see on the sites, whether it be security, whether it be designs or structures of such. We try to do a good job to maintain we communicate with our challenges that may come up in the realms. So, any questions on referendum?
Board Member Vandermill, is that your hand or?
No, I forgot to take it down again, sorry.
Board Member
These
Fitch?
days I'm gonna learn.
Mine isn't a question, it's more just congratulations and thank you. I thought both of the groundbreaking ceremonies were just really well done. Love that students were out there. Each school site had a slightly different flavor in terms of who they pulled up to speak, and it was great to have like all of the big community partners and kind of our construction and design partners there as well. I just thought it was great, and those little rocks. Okay, that was awesome. To see that those are gonna go into the foundation. And I love the fact that our county exec came in with that proclamation around recognizing like the sustainability that's going into the design of the school. So I thought it was awesome. Yeah, so just congratulations to everybody that was working on that. It felt good as a board member and you know what I liked about it? Even though the groundbreaking, usually you think like nothing has been done until you like do the little shovel. It was pretty cool to see like how much work had already started. Cause you could get a really good feel of like how the new school is gonna be on the new grounds, and yeah, it was pretty cool to see in the neighborhoods. So thank you.
I'm glad you say that. I'm trying to get our CMs to say, hey, what can we do in the fall to make it look that way?
I know, cause you're talking about October, I mean, we might be out in coats at that point.
Maybe those little igloos, during COVID.
Right?
Board Member Vandermill and then Board Member Post.
Oh, I meant to take it down again. I just wanted to say great job.
Board Member Most Healthy.
I'll get on the great job bandwagon. I recently had occasion to be sitting with a bunch of people in urban planning and who sit on the plan commission who took the opportunity to say, Scott Sheehack's great job. You're really lucky to have him. So I wanted to pass that on. Looks like great work. We're so lucky as a board and as a staff to be able to be here for this. I think board member Muldrow said, it's not every day you get to build 10 new schools and sites. It's really exciting. That's it for me.
Thanks. All right, seeing no other questions or comments, we can move on.
Okay, we're gonna move into transportation, and I know we'll probably I'll have some longer comments at our board meeting in April, but this is the first time publicly with you that I've been able to acknowledge the fortunate crash we had about 5 days ago, April 8th, on the intersection of 12 and 18 in Park Street. Vanessa Cruz is here to present to us tonight. And, you know, sometimes you don't truly appreciate what goes into everything transportation until you unfortunately have a crisis in which people have to respond. And everything I've been able to review, from the driver, the attendant, some really incredible community member, police and fire, and then our staff who just wrapped their arms around what was done. Scott was leading, you know, a occasional charge with others at Lincoln Elementary School. It was organized chaos for sure. But I'm just so grateful that nobody was seriously injured. And that all the safety training that is in place worked. I can't reiterate enough what Chief Patterson said. People slow down. You should, since Sasha's death on Park Street, and as of that press conference on the 8th, they have issued over 300 citations. Just in that corridor of Park Street, so it's an area of emphasis. Note the signs are 25 miles an hour. There are flags on them. People do, as Chief Patterson said, people need to slow down and pay attention. So just really fortunate, Vanessa, think you got there a little bit late because that buses to get throughout the city, and you know, you don't get a chance to pause because you've got thousands of students every day, all the time. So thank you. Thank your team, and thank First Student too for their response.
Thank you. Yeah, I actually made it to the scene. I was at the scene with Cedric. I was glad to see everybody was doing what they needed to do, and we got the kids to Lincoln. Yeah, so.
No, I second that. The community wrapped its arm around us and really took care of us, and it's hard to fathom at times what could have been, but to see how the response happened. And our heart also goes out to those Midvale and Lincoln families that experience it, right? It's always a tough challenge, and we all try to do our best, but it's hard to put somebody else as a parent in their shoes. You have to kind of think as a human being too. So definitely a challenging day, but our city is resilient, right? Our students are resilient, and from that we learn. So with that, I'll turn it over to Vanessa. We'll talk a little bit about statistics for our transportation, and we'll talk about a new process that we're putting into place. To get very analytical on how we look across the district for hazard transportation, what is and what is qualified, and working with city partners. So for that, I'll turn it over to Vanessa.
For that. Okay, yeah, so this is our current statistics in transportation. So we have 7,708 students on yellow bus. We have 404K students. That is not included in the yellow bus number, so that's addition to the yellow bus students. We have 654 on specialized transportation, and we're 337 TEP students. So as I've talked about in other times when I've been here with you all, our transportation is complex, right? We have a lot of students that we're moving around. We have a lot of programming. We're always trying to make the best decision for how to get students where they need to be efficiently, in a cost-effective manner, Bob, and making sure that we're being responsible for the processes that we're responsible for. So so this is just an overview for this. And as we're even thinking to the future, making sure that we have the capacity for expansion, and with the challenges that our city's got with just logistics, with where buildings are going up. Just today, I got an email about a building that's going online, and we have a family living there, so now we have to add a stop. That affects the whole route. It can make the route longer. Is it going to fit within the route that we have, or do we have to add another stop? We have to shift stops from one bus to another, all that kind of thing. So it's a constant state of analytics to try to figure out what the best way to transport our students is. So when we look to next year, we like Scott was saying, we're trying to think differently about what we do.
not just doing the same old thing, but really trying to say, do we have ways that we can expand our capacity? So we know we have first student, we know there's some driver shortage. They're continually working to increase the number of drivers that they have. But some of our programming is really complex. So one of the things that we've started doing this year, First Alt, as many of you may remember, is part of First Student. They're the alternative carrier within First Student. So we have Yellow Bus, we have the specialized transportation vehicles, which are transit type vehicles and vans. And then we have First Alt, which is smaller vehicles that are able to kind of get to the farther places and bring kids in. So we have programs like Mirfono, we have the DHH program and the Follett feeder. And so you have students that are coming from farther out that we're trying to bring into a program. And so sometimes if we try to put them on a first student specialized transportation vehicle, we're actually taking up so much time that that larger capacity vehicle could, where they could do more routes in between. So when we lean on First Alt for some of these situations, we're able to bring some relief to the white van arena and then still get the students where they need to go with the trusted carrier. So that's kind of what we're looking at, and we're doing that for some areas with Reg Ed as well. So our 4K students where we have overflow, if it doesn't fit into an existing route, we're trying to be, like I said, flexible, cost effective and efficient in what we do. So with all that, the next thing, and this is what's probably the most exciting part of the presentation, I hope you all agree with that. So there's a couple parts that I'm going to talk to you about this. First, it's an unusually hazardous transportation scoring tool. And so you probably know, because you've had to approve them, that at times there's been the hazardous transportation plans that we've put together. They've come to you all for approval. They have to go to DPI. They're approved by the chief of police. And well, those are usually brought to us in a very casual sort of way. There's not a formal, I mean, they send an email, they might reach out to Cedric in safety and security. They might be talking to Scott. They might be reaching out to you directly saying that this is an area that's hazardous. But we want to move away from that type of process. Well, it's still important. And if the community sees things that are a problem or a concern, they should let us know for sure. But we want to be proactive in looking at different areas ahead of time in our walk area, all of our areas, our current areas and other areas in our walk area that are not deemed a hazard, to score them, to make sure that we're carefully transporting the students that are in the walk area. If they are in a hazard, it should be a hazard. We score it as a hazard. We can make sure those kids are safe to get to school. So the tool was put together between our team and with this Safe Routes to School planning team that I'm a part of, Cedric's a part of, Scott's been involved. We work together with the city of Madison. There's people on the pedestrian and bike team that are part of that meeting. Wisconsin Bike Fed. Tool Design is the planning group that is helping with this. And then EQT by Design helps to look for equity issues and concerns from that lens. So we've been really fortunate to be part of this process with them and going through, they're looking at some of our walk zones. They looked at all of the walk zones that we had. They looked at all of our hazardous transportation areas. And they helped us develop a tool that we can use going forward. That's an analytic tool that's very methodical. It's not just by how I feel like this is. It's okay. We have data that shows that the volume on this street is not safe for kids to walk, right? We know that the speed limit here is too high and those kids are too young. So no, kids shouldn't be walking on that street. We should be transporting them. So, so another thing that I want to mention before I go to the next slide, just is in addition to this team, Cedric and myself and Scott are also part of another team that we work with the city on. And this has been for several years now, called the School Safety Traffic Committee. And so we meet every other week and we talk about concerns that the community brings to us, things that we notice out there. Scott's brought referendum stuff, you know, parking in front of Cherokee, things like that. And so we can talk to the city about concerns that we see and then actually have something change and be improved, like there should be a stop sign here, or, you know, the sidewalk needs to cut in around Cherokee so that we can have the buses fit and stuff. So just because some of those areas are really hard to deal with. So I just wanted to highlight that work that we've been doing and that's been going on for a while. And because of that work, we were pulled in to be a part of this other planning. Okay, so UHT as defined by DPI, the unusually hazardous transportation zone, is defined as an unusual hazard that's an existing transportation condition that constitutes more than an ordinary hazard and seriously jeopardizes the safety of pupils traveling to and from school. So we're transitioning to a data-driven safety oversight and not just those narratives of it feels like it's unsafe, but we want to really be able to score things in a way that's equitable for all of our students. Because if one area has more of a voice than another area, well, then there are kids that we're not paying attention to. So we need to make sure that we're being proactive to look and analyze these areas to see if they're safe. Okay, so again, historically, intersection safety evaluations were reactive and narrative-based, relying primarily on concerns reported by family or school leadership. So going into this next school year, we've already started. I mean, we're starting right now in these next few weeks here. The transportation department will be proactively auditing all walk areas using a standardized objective scoring system. The goal is to ensure equitable safety standards across the entire district through a rigorous, measurable methodology. So to kind of break it down in a simplified way for everybody, there's two main areas that we're analyzing when we're looking at how students are walking to school. We're looking at their route environment, so non-crossing criteria. So these are students that they go out of their house and they're walking along a road and they don't have to cross any major intersections, okay? So we're looking at, are there sidewalks? How long are they, how many miles do they have to walk? What's the volume of traffic on that road? What's the speed limit on that road? And then we're also looking at crime and harassment. And when we talk about crime, we're talking about crime that's in the right of way of the public. So not domestic things that are happening in a building, in an apartment building, in a house somewhere. We're talking about crime that is happening in the right of way. And then when we're looking at the other area is a crossing criteria. So this is for intersections. So it's really looking at, you know, how's the stoplight? How many lanes of traffic are they crossing? Is there a timer for pedestrians? So it helps them judge when they're able to cross. The other thing that's part of this that I didn't mention is just the age of the student. So like kids at Midvale are gonna have, they're gonna score more likely to be a hazard than somebody in a middle school, right? Because they're younger, their abilities are different. So they receive a higher score towards a hazard than a middle school student would. Yeah, thanks. Okay, so then this is just an overview, high-level overview of what the score looks like. It's a little more complex than this, but just so that you see the different parts of it. So grade level points, right? Adjustment for age, environmental safety, crime, harassment, that kind of thing. Other special concerns, are there railroads that they have to cross? What does the railroad look like? What's the structure of it? And then the infrastructure and path quality, again, are there sidewalks? What does it look like? Some of the parts way in the middle here of Madison by Shorewood, you've got really narrow roads with like a lot of bush and shrub along the sides. And so those are areas that have been brought to our attention in transportation for bus stops specifically. And we're going to be looking at those things for our students. And that would give us the non-crossing score. And so then for the crossing score, again, we're looking at lanes of traffic volume, speed, and then intersection controls. And that would give us the crossing score. So the reason why we're here to share this with you is we want you all to know that we're taking these precautions for our students and we're being proactive in looking at hazardous walk areas. But also as the board, we have to present them to you and then you have to approve them. So this is the timeline of what we're looking at when we're going to be moving forward with this work. So between now and the summer, MMSD Transportation is going to be reviewing all of the current UHTs and walk areas for potential hazards. late in the summer, we anticipate being ready to meet with DPI and MPD to discuss what we find in our UHT process. And then early fall, we're expecting to give you an updated plan so that it can be approved later in the fall. And that's.
Yeah, one thing I'll just add briefly, great job, Vanessa, thank you.
Mhm.
Is, we've already had conversation with DPI, got a great phone call
Yep.
or Zoom meeting with them about a month ago.
Yep.
Talking about through our process and being very analytical, and they had a lot of positive comments for something that's very concrete and not subjective. The other side is when during this conversation, when we meet with them, is physically in person. Right. Dane County Sheriff's, MPD and DPI all in the room to do kind of page turning. So we'll understand the hazards, and as we come to the board, we've already had those conversations, what they'll look like as kind of the pre-approvals. Working with them to develop the tool and essentially model this tool. And we've passed some information on already from tool design of how can other districts get involved, right? How can Milwaukee maybe do the same thing, or Stevens Point or Green Bay, to really expand on what they're doing. A lot of districts have deep UHT processes and they do a great job of it. I'll plug our team has done a good job of thinking even beyond what's normal, right? There are different strengths in our district, but also have the ability to keep it, like I said, analytical to understand where we can go.
All right, thank you so much. All right, board member questions, board member most important.
I have 3 questions, but I'm only sure that one of them is appropriate. So Chair, please stop me if that's. The first one is just like, sorry, thank you for all of your work. Super complicated. I love seeing how many students you're serving, and I love logistics, so I'm a little excited to hear all the stuff. Can I ask one specific question? You talked about like the 3 different types of transportation. So there's like the yellow buses, there's first alt, and you said there was another like mid-tier.
So we have yellow bus,
Uh-huh.
we have the white vehicles that you see all over, like the transit type vehicles, and then we have first alt, which is an alternative vehicles. So we've used that type of, it's like Uber for kids kind of thing, but there are contracted carriers. We have Ever-Driven and we have first alt, and we've used them for several years.
Got it.
Already. So Ever-Driven has done help with specialized transportation, and first alt, we had them exclusively doing TEP transportation. But they've done a really great job. I mean, they've service-wise and everything, and they have capacity. And so we want to lean on them on some of these more complex routing challenges we have to make sure we have a safe ride for kids.
Got it. The other 2 questions, which again, Chair, tell me if this is not the time for it. You talked about how historically or in recent memory, the way that we've been alerted to what might be unusually hazardous transportation areas is when people feel that it's unsafe. And I wonder if you could speak at all to any work that's happening, either community education or within the curriculum in PE classes or anything like that, to increase pedestrian safety or increase the ability of our students to say, well, I feel a little freaked out because the traffic is really loud, but I know that there's 3 lanes of buffered whatever between there. Can you talk at all about like how we're answering those feelings when the scoring tool might not actually say this requires intervention?
Yeah, so I can speak a little more broadly about this because I'm not involved in all the inner workings of how it works, but the members of the city that are part of the pedestrian outreach, Colleen is one of the people that she's been at Shank, she goes to Hawthorne, she goes to a lot of the schools. She helps kids learn to walk. She's done the walking school bus. She works for the city, Colleen Hayes. And then, so they have a whole team of people that helps with that. And there are recommendations for ways that we can support our students that are gonna be part of the Safe Routes to School plan. Yeah, but it's meant to help with that education piece. And I know they do classes, and Wisconsin Bike Fed does like biking safety and everything, and they let the kids ride around. We have a few fleets of bicycles. Again, not my area. I just know that they're there. So yes, I mean, the goal is to help kids not only have transportation if it's unsafe, but also teach kids pedestrian safety, how to ride their bike safely in the city to get to and from school.
I'm laughing because I'm following this Instagram account, teenagers running as fast as they can to catch the subway.
Yes. The one with the
You
dinosaur-
watch
the one with the
video?
dinosaur?
They say, but the train's early, sorry, okay, right, and there's like, there are safer ways of using
Yes.
transit and walking and less safe ones, like just running as fast as you can. My next question, and again, tell me if I'm off, is about like non-MMSD transportation that like still kind of goes through this. And I'm thinking about like, school gets out at 2:30, there's a bunch of kids who are like, okay, I'm getting on the bus to Good, or I'm getting on the bus to my like art studio after school program. Can you talk a little bit about where that fits in? And like, you said there's three, right? There's the first alt, there's the bed, there's that other one, and then of course the family. It's how does the other piece work when students are using what feels to them like facilitated transit, but isn't necessarily MMSD?
Yeah, I mean, I know that I've seen at schools that we have the vans of these different after-school programs that will come and pick up their kids. They usually work with the school. I mean, as far as where you're gonna line up, they try to have them in the same place all the time so that the kids have that repetition, they know where to go. My understanding is they hand them off to those vans just like they would if it was a yellow bus. And so there's that level of making sure that I am passing you this child. It's not just, okay, you're free to go over there to that vehicle that's parked, but I mean, beyond that, I don't think I can really speak to it because those vehicles are gonna be managed by those after-school programs and those different community partners and not by transportation. The one thing, and I realized this after I had already created the slide and it was already published to you all, is that I didn't put down the number of students that are using Metro, and I can work on that number because that would be important to highlight too, because that's a third of our students that MMSD, like our transportation department, is routing and helping get to school. But then there are this other portion that are using city transportation to get to school that are not driving, or, I mean, there are students that drive, but yeah. So just another part that I could add for next time.
Okay, cool. I would be curious to, whenever it's convenient, to know, do we have any sense of how many of these like non-MMSD still transport the buses are showing up at our schools? Do we know how many organizations have that type of thing? I think it would be interesting to know about, because when we're thinking about like what the capacities are of the transportation that we provide, I'm curious where in our city people are organizing in different ways to get students to and from school, if they can't walk or if there's not a family member available. So I'm curious about that. If I'm the only board member who's curious about that, feel free to.
I mean, I think that's something we could ask principals, schools about, because they're gonna know, even the secretaries would probably know, just send them a survey, how many non-MMSD vehicles are picking up students. I mean, not parents, right? But like,
Yeah.
how many daycare providers, how many,
I'm curious.
martial arts classes are picking up, because I've seen all those types of vans, gymnastics, art programs.
Yeah, I'm sort of
yeah.
curious about what the scale of that is like. Again, thank you so much. We've come so far in a couple of years. So thank you so much.
Thank you. Board Member Saravo, then Board Member Nichols.
I guess, I don't know where to start. I appreciate bringing up Sasha. I think about that all the time. So on Park Street, I can't even talk about it all the time. But I had to see the memorial every single time I drive down there, and they also have please drive slowly signs put up there. Those I think are probably the most impactful things that were done there, besides the memorial that is maintained all the time.
Yeah.
So that we remember that. Who put up the please slow down signs? Do we know?
As far as I know, there was a lot of community member action doing around, and the school did some of that work, and the city has also done a lot of work on Park Street to get people to be aware. It's critical.
There's at least 4 when coming up to that specific crosswalk now. And people seeing those things upon like before you get there, I think is probably one of the impactful things that was done. besides the flags that they put on the speed limit signs.
What?
They put up orange flags on the speed limit signs, so people know that it is 25 miles an hour. Which I think it's just ignored most of the time, so, but I think the yellow signage that was put up, in my opinion, as a driver who goes that way all the time, that was one of the most visual and impactful of making sure that you're cognizant of that intersection every single on there. Is there something? I'm curious to see where this goes, because from what we were doing previously, what's put on the slides, I didn't see a lot of. I didn't know, I can't tell what kind of community input we were getting. And since we don't have school, county, city committee right now, I have no idea what kind of collaboration and shareability is going on. Because I can get a lot of emails as a board member, because people don't know where to reach out to, they send me something and then I can pass it along. But I can't go in a room and kind of like share that stuff or gain information to bring back to this room for the board members as well. So I guess I'm wondering, is there plans to, what do you do with that collaboration? Because we're not in charge of the crosswalk, and that needs, you know, I understand that the city would want to make sure that we have close relationship when it needs to getting those things done. What does that look like?
Yeah, so I can tell you in the scoring tool that we're using, so when we're evaluating very clear lines of, this is a UHT, like this is a barrier, South Park Street, this is a barrier, right? Now, we don't think about our youngest students, we also think about our high school students, right? If there are things that we need to improve, part of our team on the Fridays is going, hey, Mr. City people, Kevin is one of our main contacts. What are we doing about this? And we sit on it. Like, sit on it is like, we will have our voice and use our voice. We're doing some work on other sites in our schools of, you know, playground work. And at Franklin, for example, is like, we put bump outs here and we'll do that anyway, but how do you support it, right? So those are, it's a constant ever evolving. It's not a one time. We can go through. Part of what we're going to advocate for is our UHT tool is saying, here's an identified hazard. Can it be mitigated by X, Y, and Z? Yes or no? Also, this could be better. How do we make this better? Right? And having those, and it's good conversation. It's not about demanding, it's about what can the city do other ways, slowing traffic down or diverting traffic, all those moves. Also, when construction happens, right? That's another thing is we're working is construction happens, patterns change.
Yep.
So giving us a heads up far in advance, traffic changes. We've had a couple on winds and winds.
Yeah.
It's, we saw that coming. How are we going to tell our families where to go for the safe night? Right?
Yep.
And how do we adjust busing to accommodate that? Because those are things we have to be pursuing, not just reactive to, right? So those are things that we're constantly working through. And as we really tuned into all of these actions and the situation that happened, we were already working well before that. That just put the exclamation point. This is what we're going to demand. And the city's gone really well. They've put a lot of money for us, some things they can't accommodate to, but also we have a responsibility to our students. I've told them our budget will be making our students safe. Right? If I have to put a curb bump out here, I'm going to put a curb bump out here. You're going to tell me I can't. You're going to go tell me why I can't. Right? Those are things that we're going to start working towards. Cedric and I just had a conversation today about how do we put our RFBs in front of our schools? How do we make that happen? Right? There are things that we have fiscal responsibility we could change along with a good blessing from the city.
Pardon me, what? I put what in front?
Our RFBs, rapid flashing beacons.
Got it.
So there are things that we can do actively and pursue.
Yeah, I got confused.
But there's a lot of stuff that we can't sit back, right? We got to be forward
Yeah.
in what we want and be clear what we want. Like there's a lot of people going, I think this would be this, and I think we're going to say we want. Because we don't have 10 things. Be focused on okay, now they're focused. Let's actually put something to it, right? So that's an active process. We're actively doing it every week. Her team is well dived into that. Part of our safe routes to school, part of my job as a plan commissioner is also looking at how is this intersection going to be controlled? How are we doing with this new growth that's happening? And working with traffic teams in public or not in public. Well, let's think differently here. How do we really accent what this looks like, right? And being truthful about it. Being intentional.
Seeing a lot more. I'm actually, when you're talking about the amount of tickets that were issued, doesn't surprise me, but also like, do they correlate like the time of when those tickets were issued as well, along with finding those patterns, or are they gonna? This is probably not the question for this room, but like having fines higher, it's, do you know what I mean? Like schools
They're
and
only
stuff
limited
like that.
by state statute and with the
Yeah.
times, so they can't penalize for a special time.
Uh-huh.
But I know
In certain areas, like the crosswalks, I guess, is sort of like the
school
hazard.
zones, yeah. They have been very intentional in doing and replicating the time frame. Right? We can say, great, you can go there at 1:00 in the afternoon, I don't care. Go there at 7:30 in the morning till 8:45 in the morning, and then go there from 2:00 in the afternoon until 3:30. Like, that's when you need to change patterns. Those are the times of drivers that are commuting at that time. Those are the patterns we need to change. We need to change behavior and a constant behavior.
Are you gonna be getting updates on any patterns that they do find from intentionally being in places and looking for what drivers are doing? So I know there's a lot of, we can tell students and people how to like utilize walk crosswalks, but we also just, what are the drivers doing and how are we impacting them, I think is also essential.
Yeah, we've been very forward with this. We've got some, and it's a very open dialogue. It's a very open conversation, whether you like it or not, as it is, we're having talks about it. And not only, I want to bring up not only Park Street and some other surrounding big commuting lines coming in. We've talked about behavioral changes of stuff that's going to change, right? We're looking at potential change for school times and start times of all the city construction changes. In our referendum schools, because we're changing the site, traffic's going to change. So how are we going to change the signage this fall to get 1 year of behavioral change? Not just, hey, we're changed. It doesn't change. Behavior doesn't change overnight. It's a pattern it's an actual pattern that has to be modified and changed over time. So those are things that we're emphasizing to the city. Yeah, you can do it one time, but how do you start to shape behavioral changes? It takes time and effort. So, and they've been super responsive. Lots of tickets have been issued on those very.
Okay. So we're gonna continue to see this update or they
Constantly every week.
Yeah.
There's meeting notes that come. So.
Okay. I think those were all the questions that I have. Thank you very much for working on all this.
Bless you.
Board Chair Nichols, then Board Member Mulgrew.
Yes, thank you. Thank you, Board Member Sarava, for your questions, because I had similar curiosities as well. So I thank you for the update. I'm particularly focused on the unusually hazardous transportation. I'm gonna just respectfully say this. On the one side where you say that our previous approach has been historically intersection safety evaluations were reactive and narrative based, relying primarily on concerns reported by families or school leadership. While I appreciate that you want to shift to something that's more standardized, I actually think that those concerns are data. There are people that are seeing kids trying to cross streets. There are people walking kids to school and seeing how fast drivers are going. So I think I want to start with, for the schools that have already raised concerns, what's happening with them in this new process? Because I have definitely heard various school communities who have been concerned about kids having to cross busy intersections. They know that neighborhood well because they live in it and they walk it. So what is happening to those concerns that have already been raised as we start to shift to a more kind of rigorous tool?
Yeah, so there's two things with that. One, we do take the input, like that's half the time how we get triggered to what's happening. And we can't take it on as a sole entity because we can only control how our students move, not how the city reacts around our students. So part of that information on a weekly meeting on a Friday is the first topic typically comes up is what are the reported actions that are happening in our district? So it's the concerns of a principal, a family member, a community member, MPD. and it's brought up and we start talking about, what is it? Well, there's a high lot of speeders here and it's happening because of this. So MPD goes, I got it. We're gonna send some patrol cars out there. We're gonna monitor that a while and start issuing citations to start to change behavior. Two is, do we actually need a rapid reflective flashing beacon there? Do we need to change pattern in history, or do we have a conversation with the principal? Like, do you need to have a staff member that kind of works in this little area? Cause are they crossing mid-street? Like, they have a couple of elementaries, so they cross middle of the street and there's a crosswalk here and here because their parents park in the wrong locations. So we look at that. Cedric's team does a great job of actually watching, observing. This is a small behavioral shift that we got our staff members to take the crosswalks and away from parking cars, or change signage on the street that says no parking here and enforce it. Because we've got parents that they're the biggest violators and the safety risks that we have. We have a lot of that in our district, so it's getting them more buffering space to get away from our facilities, to give them time. And if we start seeing larger volumes of things, how do we shift that and be a UHT? Like, hey, volume traffic is not, it seems it's much higher than that. We'll do an updated count. Let's put it in play. Or construction or diversion like Park Street. There's so much volume that got there. Data doesn't tell you what it is. It's actually higher. So we'll do those studies.
Okay. Thank you for that, Scott. I'm gonna just keep
Absolutely.
pushing this.
Please go.
When I have heard school communities expressing big concerns about walking routes, busy intersection routes, tunnels, lighting, speed of drivers in the past, it seems as though my experience has been that when we have done some kind of review as the district, I don't know where the city was in that.
Sure.
So say from the district side, I have more commonly seen that we will come back and say, nope, it's not unusually hazardous.
Yeah.
And maybe I'm only thinking of a few instances, and so I may be speaking unfairly. Maybe there are more cases where you've reviewed them and they're seen as, oh, they are unusually hazardous, but I have seen typically we get a bunch of emails and concerns and phone calls from people who are like, yo, this is not safe. Somebody's gonna get hurt. And then it gets routed to somebody, it's reviewed, and then it's like, no, not unusually hazardous. So I think what I'm trying to figure out is like, how is this gonna be different? And how do we take the concerns combined with a new tool to actually try to prevent a young person from being or something more dramatic and tragic than that. So I'm not quite sure that the tool that you're talking about, while I believe having some consistency will improve that, it's still, it's not quite giving me the assurance that it meets the kind of on the ground experience that young people and their families are having. But if I could just get
Can I speak to just
yeah,
a little
I
bit?
would love that.
Okay, so one of the things, and I think Vanessa highlighted the important work that the traffic safety team does,
Okay,
right? Those concerns usually come in through Let's Talk, principals, some of the, principals, and, and then they send it to our department, Office of School Safety.
okay,
We bring it to the Traffic Safety Committee.
okay,
And it's an overall bigger committee. We have MPD, we have parking, and we have transportation, and we'll do site visits. So MPD will come out, they'll test the traffic, parking enforcement will come out, they will check the parking. We'll talk about it as a unit, like what are we seeing, what changes need to be made? And I don't know if that was always the case,
okay,
right? So now that we have this in place, principals know that they can bring that concern to our office. I'll bring it to our committee. We meet bi-weekly on Fridays,
okay,
and we'll discuss it.
okay. I love hearing that because I appreciate you saying that, like, maybe that wasn't always the case. Can I ask you, Cedric, just given the few maybe that you've had to attend to recently, is there an average amount of time that it takes to be like, hey, we got this thing alerted, everybody knows their part, and then we're gonna go out and study, collect,
Yeah.
observe,
Yeah.
and then come back and actually make a decision? Do you have like a full cycle, how long it takes to get through that, or does it vary?
It varies depending on what needs to be done after, assess and see what needs to happen.
Okay,
But usually, like I said, is a representative from MPD. They're checking out the traffic, making sure people are stopping at crosswalks and not rolling through. We get Let's Talks about, people doing that all the time. As far as parking enforcement is out there. Colleen comes out, bike traffic and bike safety. And so once we go and observe, then that following meeting, which is the following Friday, we'll discuss what we saw. And then I've been on meetings where the administrator, traffic engineering administrator has said, hey, we'll get this done by Friday. We'll get this done by, so it goes.
okay.
And if we have a concern about speeding in front of a school zone, we have the access to bring that to the meeting, and MPD will say, we'll get the test team out there. Test team is traffic enforcement safety team.
Okay,
They will send, and we'll get receipts saying, yep, we got a couple of people that we stopped, or nope, nothing. Usually when we come out, they see us and
Slow
everything
down.
is fine, right? So it usually happens pretty fast.
okay. And you would say that schools now know that they know this is kind of the new process?
Yep.
I just remember being in places sometimes as a board member and like being approached by a school community that felt like
Yeah.
they had reached out to the district. It wasn't being heard and they wanted as a board member, like, hey, can you do something about this walking route? I'm just saying, these are like, maybe they were anomalies.
Right.
I'm not saying it was anything like most recent, but
Yeah, and I mean, to speak to that, we can only what we hear, right? Like, so if
yeah,
somebody is bringing that straight to you all and we don't know about it, then
Yeah.
we can't address it, right? So, I mean, we can do things to reiterate the principles. This is the procedure. If you got any, and I usually do that during our PD trainings and welcome backs. Like, if you have any traffic safety concerns, let us know.
okay,
Go from there.
great. Oh, yeah, Scott.
We also, are in the same context of it too, is also putting materials out, Safe Routes to School to our families.
Mhm.
Here's kind of the way you should walk to school, right? There's 4 to 5 different ways, and there's the busy highway, there's the 5-lane road, and take this road that's well marked, crosswalks, there's a
Yep.
crossing guard here. Like, those are also educational pieces that we're working into this is, yeah, you can cross here, but you're going this way anyway. Why don't you
Yeah.
take the crossing guard that's right over here, which then takes a lot of the safety factors, more safety to it, right? So
Yeah.
some of it's a two-way street, like, yeah, we hear you, but also have you seen this good way to take a map? These are all controlled intersections. These are way that traffic has been patterned to in the city. Like, there's a lot of it. I think it's kind of a back and forth education.
Okay. Yeah.
But also hearing them and yeah, we got to do something. Let's go figure that out.
Right. And then my last question is just about the logistics. So when, this looks great that you all are developing a more routine, predictable way to assess, the safe routes. When it says the transportation team, is that like routes for every single one of our schools? And
So this is not routes. This is
Not routes,
walk
but
areas. So
route environments and intersections?
it's the 1.5 miles around the schools that students are
That's what I-
expected to walk to school or get there on their own, right?
Yeah.
Yes. So when you think about the way our district is set up, a lot of our even attendance areas for schools are really reduced. And so the 1.5 miles for that particular school is like, maybe it's 1.5 this way, but on the top, the boundary is really small. And there's a lot, especially for elementary they've already been mostly done. So we're just gonna review, most of the elementary concerns, those have come up and we've dealt with them. And I, expect them to be fairly similar to what we have right now. There may be areas where we're like, yes, this is an area that we really see that is unsafe and we should add a bus here, or a stop here. The area that's not been evaluated has been middle school. Okay, and so that we're gonna go through and score middle schools as well. So
So is that just like you and some of the team goes out and actually, do you all like walk the route, bike the route?
Well, we'll,
like
I mean, we'll use our
Private?
We'll use our program, so
Right.
there's websites of information that we'll use, the City of Madison traffic data, the speed limit of the
Yep.
route. It's got the crime, there's crime maps, there's all kinds of data that we can use. And then if we're like, we're not really sure, like Cedric was saying, if I'm like, this is showing really low, we're not really, we think it might be more, can we, get with the city to help us to really get a better idea of those numbers, if that makes sense.
Okay.
So,
And
yeah,
they do get studied. I mean, like
yeah.
I heard you brought up the tunnel. Like we've done site visits with that tunnel multiple
I'm sure you
times,
have.
right?
Yep.
Multiple times to watch I mean, I sat across the street and just watched parents walk with their students walking alone, biking, like, and took it back to the team, and we tried to figure out how we can, best ways of getting.
I've heard the lighting has helped.
Yeah.
It's great,
Okay, thank you so much. And then you're saying that all of that will go into a bigger plan that then the board has to approve per DPI. Okay.
Every year we take the same tools and we should let it start over every year and take at every place again. That's something
We'll
may have
review.
changed, and
Yeah.
we'll do this on an annual basis. We'll just keep checking and checking and checking.
Okay.
If a city corrects something, it's like, hey, that was a really bad hazard. Now it's 20 miles an hour. There's a bunch of beacons, there's crossing guards. Maybe that can come off.
Okay.
There's no longer a physical hazard to it. So those are that constant review or traffic or construction. Different change.
All right, thank you. Appreciate it.
Thank you. Board Member Saravo, is your hand still up?
Yeah, I just have one other quick,
Okay.
thank you, Chair. We're crossing guards, I just didn't really see I pulled out in here. How do they fit into the support for an intersection, and what prompts that?
Thank you for saying that, because I meant to call out the crossing guard, so I'm sorry to the crossing guard team out there that we didn't call out. I was like, they were part of it. We talked to them, and there's areas, that was one of the things for the area, but on Schrader Road, we tried to see if we could get a crossing guard to help those students cross. But because it's so much farther from school, it's not an area that, like, you'll get maybe just that group of kids, but maybe they're figuring a different way out to go. Maybe some families are driving, so it wasn't. The crossing guards are more closer to school than they are that farther out, but they are part of our meeting. We talk with them. Go ahead.
And they do have a crossing guard study.
Yep, they do.
So if we say, hey, we want a study done on, Schrader or whatever.
Yep.
They'll go out, there's a whole spiel that they go through to study to make sure to see if and they'll come back and say, yeah, it doesn't qualify. And it's usually because of
Not enough low student count.
not enough students that cross here for us to put a crossing. So that's how they justify that.
Even if there's a large student population that lives on the other side of the street, if, they're like, we don't see all those students crossing, so we won't be able to. Cause they're also limited in their staff, and they try to balance out places across the city, but I know Scott's been, can we get a crossing guard over here? What about over here? I mean,
It's only elementary. We don't have
Right.
Crossing guards.
Right.
City or high, so that's.
it's limited staff too.
No, I know.
Yeah, funding.
I tried
Yeah.
when I was on transportation.
Oh,
But why is it only elementary?
That's just the way the city has been doing.
The city won't fund
Years.
middle school.
Do
I
middle-
tried this 3.
MSD should pay for it.
It's the cognitive
Correct.
ability of a student in 6th grade. Should be able to navigate you.
Right. Just blows my mind. Kind of fun for determining safety by the ability of our students to be able to walk to school and not have to.
It makes your brain hurt if you think too much.
Since I'm just asking generic questions all about this, like what happens when one calls in? Like, what does that look like? Or do they already take care of that on their
I have
end
no
and like,
idea.
you know?
I'm taking care of all the staffing.
what if a
needs.
crossing guard calls in?
Yeah, one is they'll try to get a replacement for that particular site. But if they can't, usually one of the supervisors
Supervisors
will
is
go
out there.
and fill that, but they also alert the principal. They send an email and just say, hey, as an FYI, Tony didn't show up today. I'll be out there, or we can, You know what I mean? So they do have that communication with them as much as they can.
Okay. The crossing guards that, I mean, I've interacted, they're really great. And I just want to say that, I mean, some of them are retired and just, they love the kids. They love the, you know, being part of the school. So thank you, crossing guards.
Yeah. So there's really a relationship built up, I think.
Yep, 100%.
Thank you.
That's right.
All right.
That's right.
Thanks, my board colleagues for thorough questions. Mine is one simple, just for clarification's sake. So let's say a walk is designated as unusually dangerous or whatever. What additional resources are available for that?
So if it's a UHT designated,
Yeah,
get a transportation. So they don't have to cross that hazard.
okay, got it.
Or a crossing guard, or like if it's not able to be remedied by one of those other interventions, then we would provide transportation.
And so having it classified as a DHT from DPI kind of forces the city to provide resources for us.
Not necessarily.
No,
Okay.
yeah,
No,
but
if
it,
Steve, the UHT, we ask for help first.
Mhm.
And if it is designated UHT, then we ought to provide transportation. To DPI for some funding to help with that.
yeah, we
But
get,
it's not enough to cover the cost of the UHT. So. we
Yeah.
also
Okay.
share- One, can we get city design safer? Is the first challenge, right?
Mhm.
Engineer out the hazard. If that can't be done, then we provide transportation.
Okay, and so by late fall of the next school year, we can expect to see some additional.
yep,
Before the next school, we'll have the all new system in place, all with part of our transportation for next year's school. If we do find a UHT this year, as through our evaluation, add transportation to that.
Okay. Thank you so much. Yeah, this is something that I've been hearing about too. I volunteered for a few walks in the fall. So I've heard that there were some walks that were a problem. So I'm glad to see that this process being renewed, looked at again. So thank you so much.
thank you.
All right, moving on to the last item of the night, regarding budget development. I'll pass on to Gothard and Bob.
Bob and team,
Bob and team, yeah.
members of our team that are gonna present on some project projects. Bubble, wherever you can get the burn.
Yeah. Sorry, let me move my stuff again to. Let me check that.
Okay, I'll start. We're gonna have a couple of different folks from some departments, our experts talk about the already projects that we did. Just my seventh, so we basically like some in person or online. But I just wanna kind of go over a lot of the materials covered at the last meeting, but in terms of where we are in the process and the timeline, obviously the April operations work group meeting. We're starting to get some information that we didn't have last month. We have some initial allocations for federal dollars on the title programs. They're about looking like to be about $1 million less. It looks like it's a 17% cut from the year before. I'll share some districts had over a 50% reduction in their Title I funding. So we're going through the planning of how to handle some of that. Expectations. The other piece that we do not know yet is the amount of dollars we're gonna get federal government for IDA, Disability Act. And then also, we've been informed this week that there will be delays on how much they're gonna be reimbursed. So these are some variables that we don't know about that are gonna come into play as we approach first the May proposed budget pamphlet that we'll have together for the May operation, which will then lead us into the June preliminary budget. The other unknown variable is we still do not know if the legislature and governor will work out a deal for use of some of the $2.5 billion surplus. We know there's ongoing conversations, haven't heard of any final plan. We won't know that really until they come to get a vote on the floor of the Assembly and the Senate. So the hope is we'll get some money that will help not only 25-26, but increase state revenues 627.
Bob, if I could just comment on that for a minute too, you know, it is, as Bob mentioned, a $2.5 billion surplus, and they have been at a special session for several days now. In a Journal Sentinel article late this afternoon, essentially said that they're showing up and not doing anything. And it's truly unfortunate. I think the results of the referendum last Tuesday for many districts, 74 across the state, many were successful.
44.
But even those that were successful, they're noting just the incredible fatigue that's coming out of communities having to support public education, something that's defined by the state and needs to be funded by the state. So I implore our state lawmakers, Governor Evers, to get something done for public schools. There are many ways, and we've demonstrated them. Bob himself has demonstrated how to package tax relief and funding to schools. We can do this, Wisconsin. I know we can.
Thank you, Dr. Gotham. Okay, so I'm gonna skip over some, but I do want, because it is very important, talking about our strategic plan, MSD Excellence Together. It's important. It continues to guide decisions as we look at priorities for increased expenditures for 26-27, but will play even a bigger role as we implement the plan later this year in terms of 27-28 budget. But it's real important. I've been working with some department heads on the need to do strategic budget, evaluate current program. Is this effective? Is it efficient? Want to continue this? Or do we want to evaluate it, possibly use these funds differently? We're doing some of that now, but it won't really be in full force until 27-28 plan. Talked about some of the issues that are going on with the unknowns at this time. For right now, I'm assuming we're gonna have about steady enrollment, right? We'll be getting some information on our building for the future in terms of if no changes are made, what are the birth rates, what do we status quo will do? It's likely to show a little bit of a decline, but much. So at this point, in terms of our revenue projections, I'm continuing to roll forward our current number of students that are enrolled ending this year. And then we'll make adjustments as the year goes on, because that will ultimately impact revenue calculation, which will let us know how much revenue. Now, just as a quick reminder, revenues are based on a 3-year rolling average, and a critical number, third count for 26-27 won't happen until the third Friday in September. And then on October 15th, the state will tell us how much general aid that's actually certified. So I won't really have final get to October. Approved budget that we'll look at in October, but I'll be making some projections as we move into the May proposed budget and then the preliminary budget. So we have been in essence flat over the last few fiscal years, and as I said, I'll continue to project that. Because of the current projections and what I know now, I think the projections that I have for 26-27 to be about 30-31 million in new funds. Primarily for Fund 10. I think that's pretty decent where we're looking at. Now, if something happens, obviously, with the state, and let's say the governor come to some property tax relief and some additional state revenues, both for this year and next, that'll change that equation. There's no reason to believe that we will not see a reduction in our state aid next fall. We need to project about a $7 million decline. And again, under revenue limits, your state general aid go down, your property taxes have to go up, or we need to cut the same dollar amount to maintain a balance. But right, that's just the way state law works and how revenue limits play into it. Okay, I can skip over this. I wanted to update you all in terms of where we are with the base allocations for 26-27. We've added a few positions since I shared this with you at the last operations work group, which were really the numbers that we started the process in February. But working with districts, looking at working with schools, looking at some changes in terms of enrollment already for 4-year-old kindergarten. Some other staffing issues that came up from the original projections. We've added staff based on the policy. So we are up to almost 17 FTE being added. This is a in terms of where we are at just through the allocation process. we did our mega post, meaning, last Friday, the third. Yeah, it was the Friday before last, we posted all of our vacancies, so we have begun this process as we go into 26, 27. These are the details that I've, had the team and me look at it.
Go back to elementary, but
Sure can,
thank you.
yeah.
Sorry about that, I was just slow.
I'm just doing kind of a high level overview. I had to
Yeah, I
talk
know.
more on these, but given the night time, I'm gonna be moving us along. So just give me a holler when you want me to slow down, no problem.
Go ahead.
Middle school, a little bit of an increase, and then a little bit of a decrease at high school, really based on the projections that we have. For some larger 12th grade classes graduating and smaller 9th grade class coming in, right? But for the most part, well, the staff we have, it's about flat, but a slight decline. Okay. Now we're gonna get into the fun stuff in terms of priority projects. So I have updated the sheet that the table that I provided in the past. Now, we're gonna kind of switch over, when I talk about available revenues, again, it's really Fund 10. These numbers are district-wide, so includes all funds, which means Fund 80, which means Fund 50. So more expenditures than just in Fund 10. And I do that for compensation in terms of the steps. I do that for the assumed if 2.63 inflation CPI is agreed to. I'm projecting it $9.5. That staff increase I talked about, that 16.766, we budget that at an increase of 1.8 million. I've also built in an unallocated pool of 10 FTE. The last few years, historically, we've added about 20. But I do believe in terms of the addition of the 17, the decision the last 3 fiscal years to leave the 20 unallocated staff within the base, when historically those would have been removed back out and then determined if we needed it. I really think budgeting about 10 is a good spot for us to be at, to have the flexibility if we have changes in student enrollments, to give us that ability to adjust based on the third Friday, September numbers. Subject's gonna talk about a school safety, a district-wide school safety plan, 9 FTE for about 1.2 million. Mary's here to talk about the college, career and community readiness. We need some additional funds for some of the options there. Jen is live and in person to talk about the need to increase and fund our Grow Your Own to Associates program at about 776,000. This is table 1. Now we go to table 2. We talked a little bit about health insurance. I had to make some assumptions. So that $10.8 million cost assumed that the board would eventually, and of course, these are just guesses, right? To do both option 2 and offer a high deductible health plan with an HSA. As we talked earlier, those would have to be motions moved and approved at the April board meeting for this to really happen. So these are just placeholders.
Do we have to do healthcare this year? Or do we have another year left on it?
These would be board approved changes to the plan, or doesn't have to make any change, it's status quo, and that 10.8 becomes full, right? So it's a matter of just, yeah.
But the costs increase.
Understood.
Yeah. The other resolution the board would have to look at, is we talked about making some plan changes regarding, dental insurance, that is a $200,000 really for increased cost. The plan changes have a $0 effect, changing how we, manage the plan. Long-term disability is going up. I have built in the parental leave expansion, of the benefits that we've discussed before with the need to increase staff to administer it. That's being discussed, through the handbook committee right now. And then summer programming in Freedom Schools, and I don't know if Nicole is online or Cindy's gonna talk about that. But that'll come up. And then the real big range I have for potential abilities, the salary compensation study, excuse me, of $2 million to $8 million. Of course, that's also an all funds estimate. It would cover every position and all the different fund sources. All right, so in total, we're looking at all funds anywhere from, at this point in time, 34.5 million to 40.5 million. My summary on this, really to say, if state legislature doesn't step up, start changing off the public schools, they are making our job very difficult to have a balanced budget for 27, right? I've gone over I consider projects that we have right now are priority projects, but I believe they're increases that are necessary for us. Not everyone has to be done, but when you talk about compensation and health insurance and potential 2.63 CPI, those are things that have become pretty standard for us the last few years. We're in a competitive job market. As the board has said, it is the right thing to do, but it makes it real difficult without additional state revenues to get a balanced budget in 26. So I'm really hoping live up to their responsibility, but it's the state and does get a compromise and gets a legislation to help us this year and next, right? Okay. I'm gonna just summarize this so I don't have to hand over the mic. This is early literacy targeted strategy for K1. The board has by practice directed us to lower our class sizes for AGR schools for kindergarten. That's 5-year-old kindergarten and first grade at 15 to 16 students. For non-AGR schools, it's 17 to 18. That increased staffing that is necessary is part of that 17 additional allocations I talked about earlier. So this is just one of the reasons why we would increase staffing, right? All right, and Colleen, I believe, is online, and so I'm handing it over to you, Colleen, to talk, and then just tell me when you want me to advance the slides.
Sure. Thank you, Bob. Good evening, board members. So I'm here to just share information about our priority projects with 4-year-old kindergarten and some of the expansions that we have planned for next school year. We do plan on expanding our 5-day full day options for 4-year-old kindergarten. And the additional allocation is listed. It would be 3.4 teachers, 1.6 educational assistants, and 0.35 special education assistants, so a total of 5.35 would expand to our full day 4K program and expand additional full day 5-day 4K programming. Next slide. The additions that we have made, we have actually increased Olson from 3 sections up to 4 sections. We had 72 families enroll in the first month and a half of enrollment, which is a 35% increase in our enrollment. So we have added an additional section at Olson in order to provide 5-day full day program. At Hegel, we are piloting a 5-day full day 4K position with a teacher coach position. The principal and the 4K teacher and myself came up with this role of a teacher coach position. And this position would help to transition 4K and 5K together, as well as providing the planning time necessary for 4K to go 5 days per week. So we would not only have a 4K component to this position, but also a transition and intervention component for the 4K teacher to also go into our 5K classrooms. The last additional add would be, we would be converting the half day program at Shorewood to a full day 4K section at Shorewood. Next slide. We would also be expanding our full day 4K sections or number of student allocations in our ECE sites. This would not be an additional add to the budget, but I thought the board would be interested in knowing which sites we are going to be adding full day to. When we are adding that full day, instead of having, we are providing instead of 2 half-day spots, we are providing 1 full-day spot. So that's how we're gaining additional full day. So it's more of a conversion with the existing budget and using the budget that we currently have and projecting that out. We have some new full-day 4K options at MATC Early Learning South Campus, which has just opened. We'll be adding some additional full day programming at Meeting House to help support Shorewood, as well as a bilingual site, Pequeños Traviesos, will be providing some additional full day programming. And we will also have some additional full day programming at YMCA East. The map there kind of gives you an overview of the blue dots are our school sites where we offer 4K program, and the green dots are our 4K community partner sites. Okay. Next slide. Okay, I'll turn it back to you, Bob.
Thanks, Colleen. I'll just go through all the slides. Chair Castro.
Yep.
Cedric, I give you the mighty tool. Perfect. Perfect.
You
All
have
right.
the power.
I have the power. All right. Good evening, President Nichols, members of the board, Dr. Gothard, other district leadership. I'm here to talk about Office of School Safety, strategic investment in school safety. I'll start with like current model versus proposed model. Right now, our current model provides limited school security assistant coverage across the district. We currently have 13 schools that have school security. That means there's 39 that don't. That includes 8 out of 12 middle schools, 5 out of 6 high schools, and most importantly, just no dedicated school-based safety support across 32 elementary. In addition to that, there are a few key gaps that I'll be talking about tonight as well. Floater positions at the middle school level. There's no consistent backup support at the middle school level. When we have staff absence, we had a couple of incidents this year where we had to have coverage in middle school, but we didn't have any backup. There's elementary level safety support model, and then we have currently have limited ability to provide coordinated or rapid response incidents across the district. So overall, the system is more reactive and limited in its ability to scale response consistently. With this proposal, I'm proposing that we shift to a more intentional, equitable, and proactive approach. First, we're looking at expanding SSA coverage to better align with enrollment and school needs. Second, like I spoke about the floater, this is to help at the middle school level, which will provide critical backup and helping to ensure consistency where there is absence or increased needs. Third, we'll talk about adding safety and security specialists who will provide district-wide mobile support, including response to incidents, supporting with school fire drills, special events, sporting events, bus stop support, and any other high need situations. So most importantly, this model allows us to move to a more reactive approach, a more proactive approach instead of reactive. It better supporting our school day-to-day, provide more equitable coverage, and also improving the ability to respond quickly and effectively when needed. So right now, there we go. Where we go back.
You're moving too fast.
I am, right?
Cedric?
I'm trying to get back to where I was at. Oh, there we go. There we go. All right, bear with me, bear with me. All right. All right, here we go. All right, so first investment. Why this investment is needed. So I talked about middle school coverage. Right now, Hamilton Middle School does not have SSA coverage. Under this model, we would put an SSA in Hamilton. There's no backup coverage. Like I said, at the middle school level, I spoke about the
feeders, the floaters rather, and that would help alleviate any absences at the middle school level, specifically middle school, because like I said earlier, we don't have any middle school subs, or if a middle school SSA calls in and for whatever reason, then we don't have anybody to replace them. So under this proposed model, we would have 2 floater positions, one for the east side and one for the west side. Right, 32 elementary schools without a dedicated security, right? So with the mobile response, we'll have 4. We're asking for 4 positions. That would be 1 for each feeder, each feeder pattern. So that would be dedicated toward elementary. We'll have high schools taken care of under this, as well as schools. But the mobile response will be more of elementary based. So there will be in that feeder, any elementary in that feeder, will have a mobile response in that position. So this is just helping alleviate inconsistent coverage across the district, and then increase the need to be more proactive. Again, this is just speaking about the floaters, the positions. So security assistant floaters, talks about the role, safety and security specialist district-wide, and that's, feeder based. And then at the bottom is just the key distinctions between what the positions are. This is the cost with working with Bob on what that would look like for the district. 2 security assistants, 2 middle school SSA floaters, 4 SSA security specialists. Again, those are mobile. And that will be 1 for each feeder, and then of course a security manager. Spoke about the mobile response, where we looked at purchasing 4 vehicles, 1 for each feeder. And that's the cost per vehicle is like 55,000 per vehicle, for a total of 224 vehicles. I also just want to add, this shift is really about putting schools first and building systems that is consistent, equitable, and responsive to all the needs of schools and not just some. And so, thank you.
Hand to Mary.
Gonna be me.
Thanks, Cedric.
Yeah.
Oh, perfect. So thank you, board members, for having me tonight. Before we start and kind of look at the slides up here around our early college and credentialing, I just want to bring everybody's attention back to in the fall, you adopted 3 performance objectives. Performance objective 3 is around college credit and credentialing, where we've stated MMSD will increase the percentage of students who graduate with credits or credentials that provide post-secondary value through course providing college credit and industry credentialing. So I just want to put that in the air and know that when the CCCR department is asking for $278,000, this is not necessarily driven by MMSD, but driven by our partnerships and our providers. So just kind of grounding you in, when we ask for the $278,000, it's really around the early college need that has been increasing. So our academies are now almost $7,300 a student, compared to $7,125 this year. You times that by about 250 students that we have attending, gives us about 1.4 million just for STEM Academy, and about $370,000 for our senior academies. We also have seen an expansion in CNA, which provides each student 3 college credits through Start College Now, but being mindful that that is a cost where we're paying $150 per student for their certification exams. We're paying about $100 for their background plus the college credit. This past year in Start College Now, which is our early college with Madison College, we were able to provide over 700 credits for students, but be mindful they come at a cost, which was at one time 175, now to 200. We were able to provide early college credit, which is the UW systems, at over 600 credits this year, which were at 225, and now that cost has gone up to 250. So just being mindful when you're looking at the 278, that's kind of where our monetary costs are coming from. That's really where I'm at.
Next slide.
Oh, next slide. Oh, yes, so that's just basically, you can see where the investments are coming from. It's really around the early college expansion, a little bit around our contracts, and a lot around our supplies and materials, especially when I'm talking about CNA. We have to provide, because those are more of that's offered on our campuses. So we are providing not only the instructors, the supplies, the materials, the exams, all of those things all come at a cost. That's it. Now I think I'm going to vote. Oh, sorry, I don't want that's right, but thank you.
Good evening, everyone. I am very happy to talk about the Grow Your Own to Associate Degree program, which I am going to start to now refer to as the Grow Your Own to Elementary and Middle School Teacher program. Because we are at the point where folks are going to UW-Madison to finish their last 2 years, get their bachelor degree, and earn their K-9 license certification. So, to refresh your memory, here's what it's looked like. It's been a cohort-based program where we have people who have been in para type roles, SEA, EA, clerical, those type of roles, and they have been working in their jobs for 20 hours a week, and then taking coursework at Madison College to earn their associate degree in liberal arts transfer pre-education, in which they have their tuition paid for, and they get a Grow Your Own stipend of $17,500 per year. That then makes it possible for people who needed to have a full-time job to be able to progress in their education and become a teacher in our district. Once they complete their coursework at Madison College in 6 semesters, so that's a fall, spring, summer, they transfer to UW-Madison using an established transfer articulation between Madison College and UW School of Education that allows for direct admit if they meet the criteria described. And once they're there, we will use the UW-Madison School of Ed Teacher Pledge that will pay for tuition, for in-state tuition for the last 2 years of their program at UW, which is a loan forgiveness program. So 100% of their tuition, 100% of their books are paid. They're employed as a 0.5 FTE for their 4 years in the program with that stipend, which increases with our cost of living increases as we go. Wraparound and high touch support from a dedicated advisor at Madison College, advising at School of Education, and my support to help with everything that they need in order to succeed in their program. So going forward, oh, and they have participant agreements as well. Let me also say that. What we've looked at, like in the program so far, cohort 1. So if you think about the initial cohort size, we had 19 people. 89% of those folks were folks of color and 21% were men. Cohort 2 started with 12 people, in which 83% are people of color and 25% are men. I'm breaking out the men because that is notable in elementary education teacher roles. Cohort 3, we're still recruiting, but we're approximating 16 people. So you can look at that bottom number, that total is 31 people. It does not include cohort 3 because I'm still recruiting that. So keep in mind that'll change a little bit. What we are asking for this time around is to make turn the program into the Grow Your Own to bachelor degree, Grow Your Own to elementary and middle school teacher. So in order to do this, we will keep the program the same as it has been in the first 2 years I described. When they go to UW-Madison, I'd like to create FTEs that are housed at central office. The way that their current salary is paid is they are on a school-based budget for years 1 and 2. We are looking to move those to a central office-based budget. This allows the school to free up that 0.5 FTE per person and hire someone into that role. It prioritizes that we have centralizes, I should say, that we have student and K-12 student and school needs prioritized for full support over our Grow Your Own program. And it allows the principal then to hire someone into the role that Grow Your Own candidate is in. By moving them over to central office, they would retain that stipend, you would retain their pay that they currently earn. The tuition would still be paid for through the teacher pledge. And it allows us the flexibility within the Grow Your Own program to help meet the needs of our participants to accomplish their field placement experiences. So in School of Education and the program, there are 3 field placement experiences they will need to do. Those are in elementary and middle school settings. There's Practicum 1, Practicum 2, and the full-time legislative required full-time student teaching of 1 semester. With those changes, we have people who are in clerical roles, who are in high school roles that would be unable to accomplish their field experience in that current role because they need to leave the clerical role to be the classroom space, or they need to leave high school role to be in a elementary or middle school space. What this request reflects is those 6.5 FTE, so that's 13 people at 0.5 FTE each, which is already incorporated in that $775,916 amount. But we need the authority for the creation of those 6.5 FTE separate add on the budget. You can also see on this for fiscal 27, how much of the money is going towards helping the people who are at Madison Hill. There's 25. They're in different cohorts, cohorts 1 through 3. And then how many are at School of Education, also under different cohorts. They're different cohorts because it's flexible. We allow people to come in with credits already, which means that they may have a shorter time in our program, or if they have more developmental classes, they may need a longer time. And that puts an end to mine.
Okay, Cindy, are you online?
I am online, Robert Soldner. Thank you. Good evening, everybody. I'm gonna wrap us up. Can you all hear me okay?
Yes, indeed.
Okay, thank you. I'm going to wrap us up with our last priority project for the evening. This is related to our summer programming and very specific to early literacy. So you can see in the top bar, our goal is for next summer, so the summer of 2027, to expand our summer semester for students that are in 4K through 4th grade. We would like to have 300 more students be able to access our targeted reading instruction. So a shortened summer program to focus just on building reading skill. In addition to that, we'd like to continue to expand our community partnerships and grow that to another 150 students in kindergarten through 5th grade. The chart below with the green bar shows what those amounts will look like for each component of our early literacy summer programming. For summer of 27, we'd like to see an increase in $20,000 for those summer community partnerships. We'd like to continue to expand our freedom schools, and I'll go into more detail on that on the next slide. $20,000 to continue to expand our targeted reading instruction for early literacy, and an expansion of summer semester in general for our students in 4K through 4th grade at $100,000. A total of $340,000 increase for next summer's summer programming related to early literacy. Next slide, please. So a little more detail on freedom schools. The Board of Education might recall that last summer, summer of 25, was the first year we were approved and were able to run freedom schools, a program that really uplifts Black culture and prioritizes literacy instruction. We're the only program in the state of Wisconsin. We continue to be the only program in the state of Wisconsin. Last summer, we held it at Mendota Elementary School with 50 students, had amazing success. This summer, we're super excited. We're gonna host at Lori Carey, and we're expanding to 100 students based on the board's approval of an expansion for last year's budget or this current school year's budget. Our goal is to continue to expand and have 2 sites for next summer. Both of those sites we'd like to see with 100 students at each site. In order to expand, we would need a budget of approximately $200,000 so that we can run 2 sites for the summer of 27. If successful with 2 sites, not for tonight, but we would like to consider thinking through what the future expansion and where we would like to stabilize Freedom Schools for the summer, with considering 3 or 4 sites total that would run permanently every summer, same location, so families and students knew exactly where to access Freedom Schools. So again, the ask is $340,000 to do an expansion of early literacy programming for summer of 27. At this point, the next slide goes back to Bob, so I'll turn it back to Bob.
Thank you, Cindy. So I just wanted to end the conversation about the 26-27 budget, talk about the process we've created for any other additional amendments Board of Education members would like to do. We sent out a memo on March 20th, created a form to allow you all to submit budgets, scheduling meetings with us. All those amendments were due today. But you know, TJ is a flexible, open kind of guy, so I entertain them. TJ, you are flexible, but TJ is not smiling. Okay,
No.
that kind of fell a little flat there. But so that's just that overview. Here's the timeline. We are open. And so why we create this timeline in the spring is we're looking for any changes to our current budget for 25-26 to allow us to process and build that into the June preliminary budget. So if we want to hire new staff or get a program off and running for the 26-27 school year, I'd really prefer that to be part of the June 26-27 budget. And so we'll be talking about any potential amendments next week after staff, including me, anyone else that would be the subject matter expert to analyze these amendments. And then we would go over any board initiated amendments at the May 11th operations work group. Again, all in anticipation of putting together that June preliminary budget. All right, I hand it back to Chair Castro. Good job, everybody. I want to say thank you for being efficient and keeping us moving.
That's right. Board member questions. Board member most welcome.
Thanks. Thanks team for all your info. My first question, Bob, is for you. And it's about how something ends up on your priority projects table or not.
Yeah.
So I'm kind of like, you talked about having different departments do strategic budgeting. And so I guess my first question is like, are there examples of departments who have said, hey, we actually need $200,000 more on this? And you've said, no, make it work within your budget. I won't be putting that on you. To be really like blunt about my question.
Sure. I mean, I get approached all the time and I often say, let's think about this. What else can you do? I don't make any decisions in a vacuum. I bring it to CELT.
Okay.
Discuss all the programs with Joe and TJ and assistant superintendents. We go back and refine it. To me, like a perfect example is we wanted to expand 4-year-old kindergarten, right? We are expanding kindergarten, but we would love to expand it even more. But what I've been explaining to senior leadership is we don't have a lot of revenue right now, right? It's really tight right now to have a balanced budget. My goal, I believe it's the board's goal, is to really do everything possible to have a balanced budget for 26-27. So we need to pick and choose, and we might not be able to do all what we want to do today. But if the state gives us more revenue in the future, you know, we can continue to expand. And that process really began when the allocation process late fall, early winter. So we were talking to all the departments about, okay, we know what you have now, staff that are in the schools. What are you thinking you need to continue your program? So we were beginning to identify some areas where we wanted to expand. But it's really an analysis of me talking initially and then gaining information and then talking with Carlette or Cindy or Scott or Jennifer about, I don't know how much we can do here really.
Got it. Thanks. Mm, I share your commitment to a balanced budget. I guess I'm gonna say that out loud. I appreciate the insight there. My second question, is about the safety team. My first question is about what was this, like, under what circumstances did we get to a spot where Hamilton doesn't have an SSA?
So that would predate me.
Sure, I wasn't meaning to.
No, which is fine. What I didn't add is that Hamilton is our largest middle school,
Okay,
right? 798 students, 96 students. Been speaking with the principal there, for a couple of years around how to make that happen. So just started having conversations, looking at, his need, just talking to him, and then, trying to put it together. So our biggest middle school does not have a school security system.
so the reason I'm curious about it is because my wondering is like, did that occur in an allocation workbook process where something was converted?
Yeah.
And if that's the case, no, it's not?
No, not. They never had one.
They just never had.
Just never had one.
Okay.
So that.
History on the security systems was the high schools had two.
Mhm.
When they were first created, 2007, 8, 9, they were expanded to 4, they now have 5. Middle schools were brought on eventually, middle schools never had SROs. So it was started as a pilot at middle school and it's.
And there are only 8 out of it. Yeah.
Okay,
Hamilton wasn't on the list,
okay,
the initial one.
I got it. Just kind of weird fluke. Let's fix it. Got it.
Yeah.
My second question is, I wonder if you could tell me a little bit about the process by which you developed this, this proposal.
Mhm.
Like, how long have you been thinking about it? Who did you talk to?
I've been talking about this for quite some time. Just it was more so of a inside out. Like I go to a lot of schools, right, and just speaking with principals, asking what the need is, meetings, and just trying to put together kind of like a criteria, right? Because when Hamilton said we want a security assistant, I got to ask the question, well, why don't you have one, right? I asked my supervisor, TJ, right? Like, what's the criteria, right? And so just trying to working on putting that together to make sure that they had one, or the district now has a criteria for that. But it's just a lot of research, right? And then like with the middle schools, like Dr. Gothard said, middle schools historically only have one SSA. When that SSA is out for whatever reason, generally I don't have anything. Principals will say, well, I need a sub. Well, who can you give me now that such and such is out? Well, I don't have anything, right? So with this proposal, I'll have a floater, one for each side of town, one for the west, one, and that floater will be designated or guaranteed 30 to 40 hours. With this rotation, every middle school will have at least 2 SSAs within this rotation at some point in time, whether they're doing 2 weeks, 3 weeks, moving on to the next, we'll just keep it going like that.
Can you tell me a little bit more, thank you,
Yeah.
about, I'm especially curious, I suppose, about when you talk to SSAs.
Yeah.
Are they like, yes, please, this sounds amazing?
It's
Or are
actually
they-
principals.
It's principals.
I mean, especially at the middle school level, right? Because we don't, I can think of 3 incidents this year where a middle school SSA has been out. Right? And then like principals will say, okay, I need something. Well, I'm sorry, I can't give you what I don't have. Right? And so that's what generated the conversations around, okay, this is a need. This isn't a want, this is a need, right? Because now I feel unsafe, right? And so that conversations and speaking with principals is like, okay, I hear you, so let's try to make it happen.
Can I add something to this? I think the other thing to add to that, one of the things that's what Cedric is not saying is just about how he's really built the vision for the Office of School Safety so that it is moving away from being reactive to more proactive. And in order for him to be able to do that, he's developed a 5-year plan. And the first thing of the plan was first and foremost to identify, which is this first year, of what is it that all of our schools actually need. So it's right now, these positions, while they're in central office, they are all touching our schools. And that's the most thing to ensure like that is happening. The second thing is just the way in which he is teaching himself to learn by making sure that he's understanding what is the landscape, not just here in Wisconsin, but in other different states.
Yeah.
So collaborating with the council and those individuals to think about what those other schools are doing.
Yeah.
How do we shape that to make sure it's going back to what his vision is in the next 5 years for the office?
Yeah, I'm sorry. Thank you for bringing that up. I actually do a lot of conversations, phone calls to other districts to see what they have, right? Sitting them on like Dane County safety directors, whether we got Middleton, Verona, Sun Prairie. So we're all together and just seeing what they have. But I also reach out to bigger districts, you know, Minnesota, been working closely with them. That's how I actually came up with the security specialist position. Iowa, Buffalo, New York, just reaching out to those security directors to kind of see how, and these are our school districts that have, and even larger, right? So I also do plan to visit a couple of these districts just to see how they're operate, if, you know, we get these positions, to see how they operate. And so I can bring that back to our district.
I really appreciate the proposal and I'm forward to continuing to discuss it. Do I have one more question about that? Oh, yeah, it's not a question, it's a comment. Scott, this will be really familiar to you. If this should go through, I really hope that there are opportunities to introduce it into the curriculum so that students have a chance to talk about what community safety looks like, to talk about who's looking out for them, to talk about all of that stuff. So that like, as we build towards your 5-year plan, that we're helping students to come along and see that as well as part of their learning. That's all my questions about that. And my last question, thank you for your work always. I love the Grow Your Own stuff. It's so exciting that the Grow Your Own 2 associates is moving on to a bachelor's degree. That's incredibly exciting. And I feel really, really happy and I hope you're really proud. And I hope all of those employers are really proud too. It's a really big deal. What do you imagine that those 13 people will do?
Great question. Yeah, during the 2 years.
Well, I mean, they're gonna be studying and they're gonna be doing their practicum.
Yeah.
Is that kind of it, or are you imagining they'll have a role?
They will still be in their schools, their home schools. So what we'll do, so while their FTE will be here in central office, they will still be going to their school as almost like an extra 0.5 FTE principal to help move around in the school as needed, except when they're doing their practicum experiences or their field experience. So the principal will still have a lot of connection with that staff member, and they'll be able to get their practicum and other field experiences done and their coursework while still retaining touch points into their home school that has been supporting them through this so far.
And it would look different based on the school, right? Like,
yeah. So if I'm
I might be doing some tutoring support, and a different school I might be doing some other.
So if I am in a middle school and I am a SEA, then I would remain in that SEA role, maybe moving around to different classrooms and helping different teachers. Doing that in addition to then, let's say I also have to go to an elementary school for 20 hours a week to do my field experience. And I'll go there and do that for a few times. So by being able to have that role in central office, we're not letting the school or the students short-staffed by moving the people around for their practicum.
I understand.
Yeah.
Thank you. I think that is all of my questions. And my amendments will be in by Wednesday.
Thank you, Board Member Nichols, then Board Member Sarago.
Right, thank you. All right, thank you all for, I'm gonna focus just in on the priority projects. I would say I wasn't surprised at all to hear about 4K expansion. That seems pretty consistent, with some investments that we've been making. Thank you for explaining the college, career and community kind of partnerships, additional asks, and our commitment to our scholars earning college credit. That seems like the right investment to be making from my perspective. Grow your own, no surprises there. That continues to get, we continue to build on that. I just want to make sure as to follow to Board Member Mosner Feltham and your point. When you're talking about the budget ask around the FTE being central office, this is my interpretation. You're saying we want to fund the positions. Is that right? Coming out of like central office instead of it being in the school's workbook.
Yes,
Okay,
yes.
all right.
And those positions, that
Yeah.
6.5, the 775,000 that you see, that's what it takes to fund those positions.
Okay, got it. And there's no risk to those employees around their original bargaining unit or anything like that?
I think we need to come back and answer that.
You can come back to
Yeah.
that.
Mhm.
Okay, thanks.
There shouldn't be. Shouldn't be.
Shouldn't be, but
They're gonna be.
They would be
fully-
similar, I would think, to like people
Same
that have been in
contracts.
teaching, learning as like a teacher leader that's like out of central office, but
Correct.
still is a teacher.
And
Okay.
even when they go to their school, that would only do roles or things aligned with the conversation we would have with principals is. We would wanna make sure like the duties that they're being assigned are closely related to their jobs. You would not wanna make sure you would assign them outside. So like Jen said, we have clerical. I would not put a clerical in with a student necessarily unless they were in doing their
I
practice,
wasn't thinking about the clerical.
right?
Yeah.
Okay, yeah.
I'm just
Can you
saying,
all double check on that? Cause I understand, like, they're coming from a certain unit. They're now advancing in their degree completion.
Can I chime in and answer that question for you, Board
Oh,
President?
sure.
Sorry about that. They will stay in the assigned position that they are in. So if they are an SEA, they will stay in the SEA. If they are an EA, they will stay in that throughout the process. And then obviously they transition excitingly into a teacher role. The being housed at central office is more of what Jen indicated, to not burden the school with somebody being gone on a regular basis. So the school has that staff, but those individuals will still have the security within the position type that they are in. Obviously, all things pending around performance, but they would still have that security within that for the year. And then obviously we'd evaluate at the end of year one as they go into year two. We've been working really closely with our HR department to ensure that that holds true.
Thanks. There weren't any major surprises for me around the expansion of the Freedom Schools. The only thing I wasn't sure of is so Mendota was the first site. And then it's moving up to 100 students at Lori Man Carey. Does that mean the Mendota Freedom School is like done? Or does it how does that work?
Yeah, I can chime in. So we moved the site to a more central location after conversations to think about access for students. Our commitment to our students that were at Mendota is that if they wanted to, for third, fourth, and fifth grade, those are the grades we're serving. If students and families wanted to continue at Freedom Schools, that we would prioritize their spots and work with transportation for those students to be able to come to Lori Man Carey. The conversation about potentially having a south side, a north side, maybe a west side location is what we'd like to move to for a stable future. And that's part of what we will take into consideration based on, you know, budget approvals and experiences over the next summer.
Got it. Thank you for that. Okay, so I think the one big surprise tonight was the addition of, school safety, not in a bad way. Just, that isn't one that we've discussed as much in previous budget years. Board member Mosner felt asked, quite a few of the questions I would ask. I think the one thing I am still wondering about is, can you talk a little bit more about the 4 safety and security specialists combined with the mobile feeder, rapid response, the vehicles? And then what, so I know just from talking to you at one of the groundbreaking celebrations, very briefly, that you had done some research looking at various models, but I don't know if that's as clear around what those 4 roles, how they would actually use the vehicles, respond in a feeder pattern. And then what the security manager. That piece.
So the security, okay, so for mobile response, so to speak, they would be more, like I said, in a feeder pattern, right? So like, let's say La Follette feeder, right? One vehicle will be assigned to that feeder. And they will support everything in that feeder, right? Mainly elementary, right? Right now, we have no supports at elementary, right? We have high school where we have 5 SSAs. Middle schools under this proposal, well, middle schools have 1. Elementary has nothing. So with this mobile response, this position will mainly hit the elementary, but also support the other 2. They can support middle and they can support high. Right? So we have incidents that happen at bus stops, right? Mobile response could go help support that. Sporting events, band concerts at schools, right? Mobile response can go and help with the principal with around, you know, people coming into the schools and just keeping an eye on the concert. Football, basketball games, like there's a plethora of things that we can use the mobile response for. There will be one at West Feeder, East Feeder. So, yeah.
So.
And then that manager will help day-to-day operations with overseeing the safety and security specialists. I mean, the safety and the SSAs as well as the mobile. So it will be a shared responsibility between me and that safety manager.
And this isn't necessarily for tonight, but I think I would want a little bit more information. Are you able to provide some insights about what's kind of happening at the elementary level, or when a middle school, even when they have an SSA, they're not able to respond to some kind of incident that comes up and they need more assistance? Cause and I'm trying to be careful about how we talk about this, cause I don't want it to sound like our schools are like out of control.
Absolutely.
But it also, because the board isn't necessarily in the day-to-day. I don't know if I have enough insights about like, why would you need somebody per feeder pattern? Do you really need 4? Do you know what I mean? So I think some insights would be helpful about what's happening.
I think feeder patterns are just to give folks a home base. If it's an all hands on deck where there's a need for additional support, we're gonna get outside and follow. It's for sure. I think it's important for everyone to just think for a moment. At 39 of our sites, we have no daily, regular, ongoing, structured, systemic safety and security presence. None. So we focus it on the schools and react to what's going on instead of having a continuum where we're educating our youngest learners We're helping them build habits that are pro-social, building relationships with staff, with students, with their community. And trying to bring, trying to change the safety in our district and having this daily, regular, ongoing presence. Yeah, these are not folks that are going around sirens on top of their cars.
No, I know, yeah.
Chasing things. These are relationship builders who are also following a plan for our district to be the safest it can possibly be. Right. It could be, you know, I'm the principal. Cedric, I'd like you to come and observe our fire drill.
Yep.
To provide feedback. Our principals don't have that. Our principals are doing that. You know, they're doing everything and trying to organize that. So this would be a regular way that we could provide some highly trained people that could provide regular and ongoing feedback and help school sites in situations like that. So it's just a chance for us to develop what the habits, responsibilities, and consistent practices are of a safe school district.
Okay.
Yeah.
So Dr. Gothard, are you saying it's less about what some of the current incidents or?
Yeah, it's more proactive.
More about getting on the proactive.
Absolutely.
Like, let's start to really invest in
But it could
prevention.
But it could be, and it could also be a call to security before the police. We have a student that eloped. We have some, instead of at Midvale, someone's at Van Nuys. And go over Midvale and help that school be the eyes of and provide some of that assistance. It's not to say that we could call the police. This isn't to say.
No, I know what you're, yeah.
So it's just that extra layer. A dysregulated student at a school that is really providing some challenges. Again, to have someone who's trained, who perhaps was in a situation at another schools do it, where you can bring that in and support our. So it isn't just left to, you know, our staff to be on their own, the principal to be on their own. We're trying to develop some habits, some routines.
Okay.
That we currently just are lacking in some. So it's not because of anyone, because of a lack of a system.
Okay, so this is starting to build the system.
Very proactive.
Okay.
I mean, it has definitely reactive components, but definitely more proactive than anything. And this person, the vision is to make sure that they are part of their feeder. Right? Oh, Cedric's here today. Like, you know, the students they're walking, I mean, this person will be walking through the building, have access, checking in with the principals, right? Helping with loading of the bus stops or, you know, drop off, like, you know, any of that type of stuff, but definitely more proactive. It's not a, you know, reactive, and then, you know, they're not policing anything. You know, Dr. Gothard mentioned that, but like, yeah, we want them wrapped in MMSD logos, the vehicles. We want the students to be a part of that and what that looks like so that they know the vehicles, are familiar with the vehicles. But yeah, so it's definitely more trying to get on the proactive. Our office today deals with, or not just every day, but it's a lot of reactive situations, right? We're always on the reactive. So this is a chance for us to get on the proactive side.
And I think that those for individuals also goes back to answer the question that Board Member Blair asked about that educational piece. Because these are individuals who can really be in those classrooms and really knows what it means to safe community to be able to do that. This is also those individuals that's going to be able to do that work.
All right. Good. Okay, thank you. Board Member Saravo.
Thank you, Chair Castro. It was a lot, so I'm gonna try to make my way through, and there's a lot of questions. I'm gonna try to be short. Who even started? 4K expansion, budget. Actually, yeah, sorry.
Cleans out my question.
Trying to decide where we started. It's such a long time ago. I had some people ask me about how the special education reimbursement and how it differentiates from the high cost special education costs. And could you remind us how those two affect the budget and which part it it pulls from. Or it, do you know what I mean?
Yeah, I do. At a very high level, and first step is to understand it, any cost related to implementing an IEP runs through Fund 27. So that, the three biggest sources of revenue for Fund 27 are IDA, the federal reimbursement. The state categorical, we've been talking about, so said they would be funding 42% this year, DPI saying it's gonna be 35% this year, next year 45%. Then the other is high cost, special education cost, which was dramatically increased by 26. But special education and high cost special education reimbursement is really based on how high the costs for everybody else, including us, are going. So even though the state said it, it's gonna be something like probably 37-38% when it's all said and done. So the difference of that money is a fund balance transfer. Right now, we're budgeted 62 million. If the state doesn't hit their said revenues that we have budgeted, then we're gonna increase that transfer from 60 to 65 or 67, 70, whatever we need, because Fund 10 must balance to zero Fund 27. Now, what cost goes to regular special education or IDA or special ed? That's just a matter of knowing how the reimbursement works and how we want to claim these costs, which we spend the whole year working on. My team works closely with Nancy's team and Delita, their financial person. But the law changed. I've asked them to really start focusing on getting good estimates on come in. What do we think that cost is gonna be? And then I make sure we're not using our IDA funds for those high costs. 2 years ago, that's exactly what we would have done. But now with the state increasing the reimbursement, if you use your IDA funds for those costs, you can't claim state reimbursement, right? So you really need to manage the costs, working with Nancy, and the individual costs, right? It's complicated, but ultimately, if the federal government doesn't come through on reimbursement, if the state government doesn't come through on the reimbursement, that hits our Fund 10, right? So we'll use our Fund 10 balance to cover any shortage.
I appreciate your comments on what happens at the state. Really affects everything that happens on the ground and all the work that goes. Making sure that we're pulling funds from where they're most affected and where we're gonna get those reimbursements from.
And for Madison, when I say Fund 10, property taxes, right? Property taxes have to cover those costs. Federal government, state government's not meeting up to the commitments.
Yeah, no, highly impactful of everybody.
Yeah.
Thank you. I think I have a lot of questions about the 4K piece of it. I guess I was just wondering if there was any concern over merging. I was trying to, I don't even know what slide it is. 26, 27 expanding full day 4K and ECE sites. I was just wondering what kind of impact that was gonna have. Right, I was trying to just break that down.
Colleen, respond to that.
Yeah. So we're expanding options to full day, but allowing sites to choose how many spaces that they would like to be able to use. We're using the spaces that we have more effectively. And in the past, we have had projections of spaces, but the projections don't always lead into actual enrollment numbers. And so we tried to create our projections a little bit differently so that we were projecting specific amounts of students that they would have, and we allowed them to choose whether or not they would like to provide half or full day programming based off of their individual needs.
If someone would opt to do a half rather than a full day, what does that do?
So 2 half-day spaces equal a full-day space. So if they're choosing to do if they serve less kids and they are able to serve their kids in a full day program, then they could serve them in a full day program. And if they have half day programs, then they can serve them in a half day program. So they were given the option of either using half or full day programming based off of what they wanted to project as well. We would love, again, for state legislatures to fully fund 4K. So that way all of our families would be able to have a full day 4K option. But we're just not there yet. This is, step by step, we have an expansion plan. We have the ways in which we're trying to roll this out. We, started out with our students who we felt needed full day the most. And now we are getting to the point within our district where 2/3 of our district have full day options. Our community partners it's super important that our community partners are being supported along with this expansion. So we want to make sure that, they have that capacity to have full day programming as well too. So slowly but surely, we are continuing to push forward in order to expand. So the hopes in that one day that anybody will be able to choose full day no matter what site they're at. But some of it is a capacity issue as well. So it really needs to align in with the building the future and our long-term facilities range plans. So 4K isn't something that can happen, in and of itself. It really has to be part of this systematic district plan. So when we look at expanding in one location, we have to look at other locations and how does that affect different sites. And so we look at that system as a whole instead of looking at just individual sites.
Great, thank you. I'm gonna keep moving down. Thank you. Talking about the school safety things.
Yes, ma'am.
I like the proactive nature of this because I think I've asked I've kind of asked about like what are those positions, and I think when I've stopped into schools and talked to principals, like what happens when someone's on leave or someone's not there or something like that, will you just find another person who's not doing it and you try to fill it as is? And that seems to be shared across the district. So I'm assuming this is kind of trying to get at that too, because the feedback that I've gotten whenever I brought it up here is the relationship building and wanting to have someone that's consistent.
Yes, ma'am.
Students have that
Absolutely.
awareness.
And that's important with building the relationships, right? So if you have someone that's not there or out or whatever, then yeah, but it speaks to that.
Mm-hmm. And the visibility of it too, interesting, of having like the vehicles and things like that. I don't know if I've ever even thought about that before. Is that something that you said that you got that from different?
St. Paul has them, Iowa. So it's basically a security system.
Okay. I know Hamilton recently also did some of their structural to get into the front, like some of the buildings that we have don't have that initial access to the building before you get to the rest of the school.
Entries.
Yes. Yes.
Yes.
Hamilton got to do something specific to create that in their hallways. But I'm thinking of buildings like, Lapham is elementary, but they have their building struggles to get that point of entry in there. Are you suggesting that like having someone on site might help with that kind of difficult layout to work at his school, or like?
Yeah, with all, but I'll kind of lean on Scott to talk more about the 2-point entries, because that was actually one of the things that we noticed quite a few years ago. That schools were asking for, at the time, it was like welcome centers, but you know, but working with Scott and his team, like they are making it happen. So we were just at Stevens today for their new 2-point entry and whatever. So Scott and his team have a plan to have, you know, all of our schools at least have 2-point entries.
Yeah.
By the end of the 27-28 school year, all schools, all sites will have 2-point entries.
Wow, that's awesome.
2-point entries.
Yeah. You wanna explain that out anymore, or did you?
No, I was gonna hear.
Okay, okay. Awesome. I love to hear that. And also something consistent and I've heard been going around. I know very difficult times in the older buildings.
Yeah.
What else was I? Yeah, I'm not sure what else to ask. I like this. I like the concept of it and the practice. I think the other thing I was gonna ask for is like, what kind of training are we anticipating that they would be coming in with, just because I really like when we have like that mental health support built into the security aspect of things.
Yeah, basically kind of similar to some of our security systems. Now, CPR trainings, de-escalation, verbal de-escalation, stop the bleed, AED training, like, you know, a lot of verbal de-escalation. But yeah, it's quite a few different trainings that we're looking for.
For the things that looking for, like, is it like, how does it compare to what we have now?
Yeah.
I guess.
Yeah. So it would, the comparison is more, like I said, is with the mobile response, right? And so they have the current SSA school-based, right? So like the mobile response will have more like community interactions, community partner actions and all of that. So making sure that they have that piece as well to be able to communicate with the other stakeholders.
Okay. Well, I'm curious to see where this goes.
Thank you.
Like proactive approaches like that. It's been an interesting approach that we're kind of growing up in models that see this. Big in it.
Thank you.
Goodness. I'm trying to think. I've got you because you guys went last. So there's so much information that we went through. It's a lot to take them. I don't know if I have a lot of questions. It was good to get all the updates. Everything that's going on. Both with the grow your own. Just continuing to do that into CP. To continue to utilize it. Great. The only thing that I was thinking about, and Randy said that we were partnership growth. I was wondering some examples of what that looks like.
Yeah, so a perfect example is last week when you had Improve Your Tomorrow speak to you as the board. They're one of our partnerships. So as we think about expanding and growing, that's just a perfect example of how we have an additional partnership that we did not have the year before.
Yeah, because that one does expand kind of across over into college as well, which I thought was interesting. It was nice to hear directly from them, but really get the full appreciation of what that program does too.
Yeah.
And that was at the high school level. Do you see it kind of happening across, like how early do the ones that you
For IYT, for Improve Your Tomorrow, or for
in general? I guess I'm wondering like when you're talking about partnerships and the growth of them, or you're talking about college curriculum.
Yeah, no, they middle school all the way through high school, a continuum.
Okay.
Yeah.
Right. I don't have a lot of questions. Yeah, thank you.
All right, thank you. I have one question is, for our timeline's sake, we expect to have Madison property assessments and tax impact by next month.
Yes, I checked our website this morning. They do not have their assessment report for 2026. Normally it comes mid-April to late April.
Okay.
Last year, it didn't come until like the third week of May, but I believe that was later than what they'd like to do. Once I get that, then I'll use the assessed projections they have to equate to equalized value, which is what we use. The hope is I'll have that in time for the May full budget to have you take a look at tax impacts.
Thank you. Looking forward to that being transparent and showing where these referendum dollars are going. And the tax impact on the community. So thank you. Go ahead, Dr.
Final announcement, were you about to adjourn?
No, well, I was late.
Just one final announcement, just a reminder, board members, we have our Lori McCary name ceremony from 5 until 7 on Friday night. The community is invited, so please tell others to show up. Honor Lori McCary and school having its proper name.
Thank you.
Thank you. And please get a motion to adjourn.
Move adjourn.
So moved.
Can I get a second?
Second.
Board member leader.
Hi.
All those in favor? You are adjourned.